He has hosted international athletes like Phil McIntosh and Nori Williamson. He's also conducted 4 editions of the India Running Summit with renowned speakers and delivered 40 talks to corporates and running groups. Featured in publications, podcasts, TV shows, his journey from a cardiac event survivor to a running icon continues to inspire us all. Mr. P. Venkatraman.
Thank you.
The mic need?
Without mic is better.
I need to hear from the mic. Is it okay?
Without mic is okay.
No need for the mic. The mic is
Better without mic.
Okay, thank you very much for the intro. And when we founded YouTooCanRun, the original purpose was to share knowledge and make everybody run and motivate them. And before YouTooCanRun, many know from Asian Art, I used to conduct monthly meetings for the cardiac support group. In Asian Art, we used to have the auditorium, and every month we would get a speaker and conduct meetings. About 200, 300 members would be there, and about 50, 60 would come on a particular Saturday. Then over a period of time, that association with Asian Art just fell apart. Then we conducted India Running Summit for about 4 editions. Again, the idea was to bring content to an audience that wants them to know that content, but is not easily available. Make it unique and make it something that is not duplicated. So that is what we should do in India Running Summit. Then the pandemic came, and then webinars became very common, and then we felt that webinars are people don't pay attention. There is not that engagement is not there in the webinar. You don't kind of connect with the audience. And we felt I'm a little bit old-fashioned. I felt that whatever we do, it should be in person. Aankh se aankh milna chahiye kind of philosophy. And that is why we restarted this, because again we felt that there is a lot of content out there which needs to be showcased. A lot of people have asked us today whether we can come on Zoom, can you stream it, I'm in Bangalore, all those kind of lot of questions have come. We will record this, but we will then edit it and then put it on YouTube. So maybe after about a week or something, it will go live. So the others who are not here can then see it. And the content is always there for people to keep looking at. The team will write notes to the thing, put all the links, all that needs to be done to make the video more meaningful and accessible. So that is the background. Thank you very much everybody for coming. I have the pleasure of introducing Dr. Girish Bhalerao. And Dr. Girish is an orthopedic surgeon with over 16 years of expertise in joint replacement. I saw a little bit of his PPT, and you all can see more. Orthoscopy, sports injuries, and spinal disorders. Having worked in leading trauma and orthoplasty centers across India, UK, Portugal, and Germany, he is well versed in advanced orthopedic care. His specialties include minimally invasive knee replacement, robotic assisted TKR, or total knee replacement, custom orthoplasty, and revision surgeries for complex joint conditions. Dr. Girish also excels in managing sport-related injuries and has trained at the prestigious FIFA Center of Medical Excellence in Portugal. FIFA is a very large center. Working closely with UEFA Champions League teams like FC Porto and FC Barcelona. With a patient-first approach, Dr. Girish is committed to delivering cutting-edge treatments and comprehensive care to restore mobility and improve the quality of life. Please welcome Dr. Girish Bhalerao. I also have the pleasure of introducing his colleague and inviting him to the dais, Dr. Imraan Khan. Dr. Imraan Khan is a physiotherapist with over 6 years of experience delivering evidence-based, high-quality care. A graduate of MS Ramaya Medical College in Bangalore, he earned his BPD, Bachelor's in Physiotherapy under Rajiv Gandhi University, and went on to complete his MSc in Clinical Physiotherapy at Coventry University in UK. For those who don't know, Coventry is a very large university catering to sports injuries and sports related exercise science. Okay, there's a lot of people who are sports psychologists. They come from Lowenbrow, which is part of the same university. With a passion for lifelong learning, Dr. Khan has attended numerous specialized courses, including orthopedic manual therapy, neurodevelopmental therapy for stroke patients, and advanced techniques like bands, balls, and balance by Theraban Academy. His expertise spans orthopedic, cardiopulmonary, and neurological physiotherapy, ensuring exceptional outcomes for his patients. Dr. Khan's commitment to innovation and excellence in physiotherapy makes him a trusted leader in the field. Please welcome Dr. Imraan Khan. Girish Bhalerao. No, no, no.
Hello everybody. Thank you sir for this invite and for the wonderful introduction.
Mike, you need the mic?
Now,
No.
So दूसरा slide. This is like.
yeah. Hello. Hi. Good evening everyone. Thank you sir for this wonderful introduction and allowing to have interact with such a wonderful audience. So today we are going to speak something about pain in athletes, runners group, and also how this condition, which usually get ignored in your younger age, which can present yourself as you age out, and what is the scope of regenerative medicine? How can we help our patients in a much more non-operative manner or conservative line of management? So to begin with, these are some my credentials that I have done my MBBS, MS Ortho. I've been lecturer with government medical colleges of Mumbai. I have done my fellowship from South at Sunshine Hospital, Hyderabad, which is Asia's second largest high volume center for joints. I went abroad, had a good time with 6 years of abroad experience, having fellowship program from King's Medical College, Golden Jubilee Hospital, Helios Center Clinic. I am India's first doctor to be FIFA alumnus, so I had a very good time at the FIFA Center of Medical Excellence in Portugal, where we could understand the physiology of athletes very closely. Not only understanding the injury pattern, but also the rehabilitation and what efforts can be done to minimize their recovery program and give them a haste on rehabilitation. Also, at King's, I had opportunity to work in sports medicine department. Currently, I am a full-time consultant with Bukhar Hospitals, and I practice at both the ends of the city, one in North Mumbai, one in South Mumbai. So in South Mumbai, we are located at Mumbai Central, and in the North Mumbai, we are located at Mira Road. We are a 350-bedded hospital at both ends, and we cater to all the club members. We have got good sponsorship to the clubs and the state level athletes, like from FCI or from Sports Authority of India. We do get direct athlete patients from there. I'm also an honorary professor for Cooper Medical College at HBT Trauma Center, Jogeshwari. So what is regenerative? Very exciting thing. Not many of them know. Many of them have heard something like stem cell therapy hota hai, something they take from your blood and then put it again. Is it PRP? Is it something else? Like there are so many modalities. Is it steroid injection? Very commonly people mistake regenerative medicine with steroids also, which is not a great thing to do. But in very selective conditions, steroids may also be need to be given. So there are so many misnomers and confusion amongst the masses, and we need to know which applies to whom. So it's not just the medicine, it's or the modality of treatment, but it's also very important to select that patient base on which this will create its effect. So regenerative medicine deals with process of replacing or engineering or regenerating human or animal cells, tissues or organs to restore or establish normal function. Today we'll be talking mainly on the knee joint. Knee joint is human body's largest joint, and that is so weight bearing joints are the usual joints which have this kind of injuries, which can have hip, knee, ankle, your pelvic floor, and very rarely if you have a sports injury which involves your upper limbs, even upper bodies can be affected. In today's talk we'll be providing a review of common lower extremity injuries. We will be describing the epidemiology of these injuries and review the appropriate history and physical examinations to identify what kind of injury we are dealing with, which as a common man you can also have a look into it to understand, identify yourself. Many of the times what happens is these sports injuries or ligamental instabilities are neglected. Many a times the general doctors or the general physicians or sometimes even the orthopedic physicians, they are not able to एक्सरे पे दिखता नहीं. Many a times ऐसा होता है ये मोच है, लचक है, and you may ignore it, and only after a few months or something, when actually you start limping over it and are not able to get that particular effect, or the pain does not subside, then you think, okay, something is wrong. By that time, many a times our progression has increased and the injury status has advanced. So it is very important for us to understand what physical examination or signs to look out for, what are the diagnostic examinations to be done, and try to understand how it can be managed at various stages. So when you look at the knee joint, if you see on your left, many a times people see that knee is just thigh bone, leg bone and then kneecap. But actually if you pay your attention to the right, knee joint is a very complex structure. For that matter, any joint, it's not just where bones meet each other and offer you movement, but it is a plethora of soft tissue structures which give you stability. So tendons are the structure which connect muscle to bone, and ligaments are the structure which connect bone to bone. So tendons give you dynamic stability with movement, and ligaments give you static stability. Overall, they offer you the stability format in which you can utilize your body in whatever actions you want. May it be skillful activity like dancing or playing some sports, or it can be something like measure of strength like kicking something. So the knee essentially is such that the end of the bone, there is a smooth surface called cartilage, which allows you to have smooth movement. Unfortunately, human body has very low turnover of cartilage, so cartilage is very precious to us. Hence, between the two bones, we have a cushion-like structure called meniscus. So if you see, this is the real-time image. You see the thigh bone and the leg bone. On the lower aspect where MM and ML is written, that is medial meniscus and lateral meniscus, which offers you the cushioning effect, so that whenever you are running or whenever you are walking on uneven surface, the bone does not impact to each other and the cartilage is safeguarded. We are born with limited turnover of cartilage which has to run throughout your life. So protecting your cartilage is really of essence. Also for appropriate movement, you can see there are this ACL ligament. ACL is anterior cruciate ligament, PCL. So the knee joint has got four major ligaments: ACL, PCL, MCL, LCL. आगे का, पीछे का, अंदर का, बाहर का. So they all together give you stability and your control on your joint to perform whatever activities that you wish for or you functionally demand for. So this is how on the left side you will see the joint looks from above when the meniscus is offering you cushioning, and when the meniscus is on, how the joint looks bare. This is on the posterior aspect. So you would understand and agree that knee is just not bone but a mixture of lot of things, and all of these structures are inside the capsule. So the joint overall is eventually covered by a joint capsule. What does the joint capsule contains or constrains? It constrains a fluid called synovial fluid, which is the lubricating fluid. So if you see joint के अंदर कोई blood नहीं है, there is no blood within the joint. Joint is very pure and nascent. It has got a tissue called synovium which extravasates blood and extracts the nutrients which goes into your synovial fluid, which offers you lubrication as well as nourishment to your cartilage and meniscus. So if any patient comes to us in an ER or in an OPD, so what do we look for? We ask them some key pieces of history. Many times the patient describes their pain in certain format. If it's a high velocity injury and the patient hears a crack or a pop, then definitely, and there is a tenderness over the bone, we should look for fractures. If there is a give way sensation, कि डॉक्टर साहब मैं बैठ जाता हूँ, उठने के टाइम पे ना मेरा बैलेंस नहीं रहता है, मैं पैर सड़क जाता है. And during that injury I heard a pop. It can be a ligament, and most commonly it's the ACL. PCL, when there is a blow anterior to posterior and the knee goes into posterior extension, and then you find instability, especially when you want to forward propulse yourself. Then that can be a PCL tear. Meniscus is when you have a locking popping sensation. मेरा पैर ना अटक जाता है. अटकने थोड़ा सा wriggle करना पड़ता है, and then it becomes straight. But every time I move, I have a fear that my knee can get locked. Then we are looking at meniscal injury. So these are some kind of telltale signs which you can identify into yourself कि yeah, this may be the injury and this is how it is behaving. If you talk about epidemiology, though everybody is concerned about fractures, but you will understand that patella injury, meniscus injury, ligamental injury, the soft tissue injury takes the major part. Fracture which comes on a miscellaneous is hardly less than 25% of the time when actually bone may get injured. But every one of us is concerned, doctor साहब कोई fracture तो नहीं है bone में, X-ray पे. अगर fracture नहीं है, people just go away and ignore this. In the subset of ligamental injuries, ACL takes the major toll, because try to understand, knee is a very complex compound structure. It has got 3 compartments and all the forces are centralized onto the central ligament, which is anterior cruciate ligament. And hence ACL is the one which gets brunt of the major injury. If you want to stepwise evaluate the injured knee, we should understand where is the maximum tenderness. We should try to see if there is any local swelling or effusion, how your range of motion is affected, is the mobility and stability of your patella, घुटने का वाटी जो बोलते हैं, क्या वो जगह में है, are you able to track it properly? कोई स्पेसिफिक लिगामेंट मेरा लूज है क्या, चलने का मेरा पैर अंदर की तरफ मुड़ रहा है, बाहर, आगे, पीछे, अगर कोई लॉकिंग पॉपिंग जैसे एंड फाइनली न्यूरोवैस्कुलर कॉम्प्रोमाइज. सर डॉक्टर साहब इंजरी हो गया, कुछ नहीं, सब स्टेबल है, लेकिन मेरे पैर में मूंगी इंजरी चल रही है, मेरा पैर सून पड़ गया है इसके बाद में. So these are certain times. This is a very important slide where you will understand the gentleman in the white, his foot is locked onto the ground and his lower body is turned inside, the outer body is turned outside, and this gentleman in the blue is having his load. So there is a valgus thrust, foot is firm on the ground, and there is a rotational force also included. So this is the exact mechanism when your ACL gives way. So these are little technical things, maybe you may not be interested, but trying to understand ACL is an anterior stabilizer at the pivot of the joint. So all the forces get concentrated. So if you want to understand in animated form, this is how ACL is placed. The structure in the center in the green. So you will try to understand ACL is a straight structure. It is actually an oblique structure. And because our knee is also not straight, हम लोग मांडी डाल के बैठे हैं. We are not robots who will do only straight way. So we are cross-leg setters. So the common cause is your lateral rotation, backward displacement, and sideways impact. So this together will cause this kind of rupture, and the pivot or the center point of the thing can displace onto the medial side. So usually it can be seen, if you talk on the Western population, they are much more keen towards particular sports culture and all. But in India we have flexible skeletons, so we do not need to be actually playing sports. Simple injuries, garba का season आ गया, शादी का season आ गया, अभी वापस आ गया. People may out of their excitement just get up and dance, but they are not trained for it, and this is the common reason why your ACL is not well guarded. So simple, बिन मौसम बरसात हो गई, बाइक से गिर गए, and then you can have that ACL injury. So Indian skeletons are more flexible as compared to our Western counterpart, and we in general have a lesser ligamental strength as compared to the Western counterpart. So definitely whenever you find such kind of, this is the RICE mnemonic which we give, RICEC. So in which rest, ice compression, elevation, crutches. If you don't have an access, medical access, this is the basic thing which you should do in any acute management. काफी बार पेशेंट मेरे को पूछते हैं, डॉक्टर साहब लगने के बाद गर्म लगाओ ठंडा लगाओ, बहुत कॉमन क्वेश्चन है. If there is any periarticular injury, always ice. No role of hot fomentation. Hot fomentation is given on muscular areas, जैसे thigh पे या फिर lower back पे या फिर buttocks पे, where the muscle group is more, because heat will improve the muscle blood circulation and it will offer to traverse away the inflammatory metabolites. But when you are looking around joint, knee के बाजू में, ankle के बाजू में, कोई joint के आसपास आपको injury लगती है, always ice fomentations. You can give compression dressing ताकि swelling ना आए. You can raise the limb so that the swelling, it is more under gravity migrating towards your heart, and you can use, if it is really painful, avoid weight bearing on it, and you can use a walker or a crutch support. So if you are talking about, now we have understood what ACL is. So these are the 4 grades of ACL where there can be a minimal sprain. It is just a stretch of the ACL. It can be a partial tear less than 50%, partial tear more than 50% stiff-arm fiber, and then the total tear. And the tear can happen from the attachment or from the main substance. So that was when we were talking about static. This is also the concept of dynamic knee valgus. जब आप ऐसा जरूरी नहीं कि पैर जमीन पे टच ही होना चाहिए. When you are playing and suddenly there is a jerk in your dynamic movement, then too the ACL can get injured. So these are the signs. How do we check? The joint may show instability. We can do X-rays or MRIs to understand if there is any. So X-ray will always give you the bony part, how the bone is looking. MRI will give you the exact diagnosis. So this is a demonstration of a young lady. She is a Kho champion, national level Kho champion, and if you can see, her knee is very unstable. Can you understand? If you see, there is complete displacement of tibia and femur. There is no stability component. And if I am examining her on close, you can see if I am trying to push it medially, giving her a varus stress, the patella just pops up. So just imagine when the patient is walking on the flat surface, she has no confidence to even move a short distance. So these are the injuries, definitely. So we understood how history takes place. This is called anterior rotator, which I showed there at 90 degree. When we do it at 30 degree, so the weak arc of knee joint is 30 degree to 60 degree. At this arc, the knee joint is the weakest, and majority of the injuries happen here. So at 32 degree, 60 degree of range, if the instability, we can understand it by Lachman test and pivot shift, which I was showing you the pop. So when we transfer the ACL forces to MCL, you will have that pop sensation. These are some clinical signs for us to understand. When we do imaging, you can see there is some fracture line over there, which is circle in white. So it can avulse from the attachment, or it can avulse from the, or it can break into the substance. So if it's avulse, we can see some, but very rarely it happens this way. So many times MRI is the one which gives us this particular picture and helps us in diagnosis. So MRI gives you 95% accuracy. So when we see an ACL tear patient in the early form, definitely medications can be tried. If it is very severe, if there is a concomitant history of rheumatoid arthritis or some inflammatory joint disorders, only then steroid-like injection. In my practice, I've written here just for theoretical purpose. I never like to use steroids in my practice. Steroids are very potent drugs, but it has its own side effects also. So if someone is proactively offering you steroids, try to give your personal history. Are you diabetic? Are you suffering from any rheumatoid joint disorders? Is there any immunocompressive thing which is happening? Sometimes people can be on chemotherapy, sometimes severe diabetes or sheer old age can also be cause of your low immunity. In such scenarios, we definitely would try to avoid steroids. You can give braces, crutches, physiotherapy in an early form, but physiotherapy has to be done through a very trained doctor. Nowadays, there are too many physiotherapy centers just opening up without a proper consultation. Even if you start exercising, you should see that your physiotherapist either himself identifies the injury by doing a clinical examination. They are also good at clinical examination, or they can refer you to a sports medicine specialist who can understand your joint better. And lastly, if there is a complete rupture, you have to have an ACL knee arthroscopy surgery, which are a keyhole surgery through half centimeter incision. You take access to the joints and give you. So, what is the role of regenerative medicine? Regenerative medicine, so traditionally we have been using something called PRP. PRP is platelet-rich plasma. Many of us may have used it. Some of us have seen its utility in hair transplant also, or sometimes people take it nowadays as they are calling it vampire facial. Yeah, they are telling it vampire facial. They take blood and then they inject into your skin, and fillers and all of what not things are happening nowadays. But PRP basically are platelets. Platelets in any human body, the normal platelet range is 2 lakh to 3 lakh per ml. And platelets are the repair products of our body. If there is any leakage, it fills. The platelet consists of clusters of growth factor concentrate. But when you put just PRP in your body, the platelets may not disintegrate and do not release. So if you are injecting 1 lakh platelets, hardly 10,000 to 15,000 may actually release disintegrate. So PRP's potency is very low, and sometimes we have to do multiple sittings. Cut to GFC, basically growth factor. We have a technology in which we disintegrate these platelets in a test tube before injecting into your body, making sure that 100% or near 100% of the platelets are disintegrated and release that growth factor concentrate. Now this growth factor concentrate has regenerative potential at the totipotent cells of your body, integrating. So if you have a minor injury, early sprain, partial tears, definitely it can be tried when the instability component is not. Try to understand, we have to be very selective in patient base. अगर आपको multiple injuries है, ACL भी है, meniscus भी है, PCL भी है, effusion भी है, then there is no role of GAC or PRP. We have to first make the joint silent, quiescent, undergo imaging like MRI, and then diagnosis. Diagnosis is the key. So typically this is how we mark the joint when we take it to the OT. We mark, these are the portals. You can see standard portals लिखा हुआ है, standard ACL reconstruction portals. There are these tegels. So we have to create, whenever there is ACL ligament, we have to create ACL. So because we are now bipedal animals, we have got extra tendons in our body. We can harvest our own tendons and use them in and replace our broken ACL with our tendons. So this process is called ligamentization. So these are the typical portals that we establish on a joint. These are all the portals. In my practice, I being a minimal invasive surgeon, I do not use all the portals. I use only 2 portals. We have got much more better instrumentation to access the joint. So when we go into the joint, we introduce a 4mm camera, and we see that there are a lot of debris in the joint. We clear out the debris. We identify the footprints. So we know the whole idea of a successful joint arthroscopy is that when you recreate ACL attached to the original footprints, then it is. So these are the graft options. You can take patellar quadriceps tendon, you can take hamstring tendon, you can take patellar tendon. There are so many, and this is how we create tunneling. We create tunnel on both ends of femur and tibia, and this is how we introduce your graft and lock it with a locking device which can be sutured. There are so many locking devices available. But in and all, this इसमें कोई बड़ा काटा चीरा वाला सर्जरी नहीं होता है. It is done through a 0.5 centimeter portals to introduce our camera system and our instrumentation and get this new ACL locked again. So this is the typical portal size. If you can see, these are the hamstring tendons which we have harvested, and we read out the same thing to give you a new ACL. So this is my camera view. On the left side you see how a normal ACL looks. On the right side you see how a ruptured ACL looks. So these are the portals which we identify. We clear up the debris. We identify the original footprints, and depending upon what type of, also we can have a opportunity to modulate the strength and the tension of the new ACL depending upon what sports activity you are utilizing. If you are a skier, if you are doing skiing, or if you are doing skating, or if you are doing football, or if you are doing kho-kho, whichever sports, we can also try to give that advantage by adjusting the portal dimensions. This is how tunnels are made. You can see a femoral tunnel in this right side picture. This is how a guide wire is placed and a tibial tunnel is made. We then pass the graft, and this is how the graft comes and it gets plugged into the tunnels, and this is how a ACL, newly constructed ACL looks. So on the left side you will see where it inserts in the femur, on the right you see where it inserts on the tibia, and that is how your new ACL looks, much identical to your original ACL. And when you respect your footprints, when you respect the Newtonian strength of this ligament, definitely our rehab is much more faster. If you go on YouTube and see, लोगों को जो एक साल लग रहा है rehab को, we do not offer any non-weight bearing part. People usually, Dr. Imraan is here to tell you, other centers people say 3 weeks to 1 month of non-weight bearing, but we offer full weight bearing immediately next day of surgery. So our rehab program from 1 year comes down to hardly to 3 months. And if you are a professional athlete, you can go back to the sports as early as 6 months, which is a much more better time frame for a professional athlete because they lose their seasons. 1 साल या 2 साल का जाने से literally that can change their career graph. So we give you a very enhanced rehabilitation protocol as well. Dr. Imraan will talk on it later. So like ACL, you can also have PCL injuries, the same kind of, I'll brush it off. But this is how PCL looks on an MRI. If you see the structure broken, we have a PCL there. The treatment usually is this on the same line. Second injury which we have is chondromalacia patellae. So this is one of the common injuries which runners have. So people who are into avid running, sometimes this low threshold suboptimal injuries keep on scraping away the cartilage, especially the patellar cartilage. So what happens is you may find some pits over there, some small crackling, and the cartilage can have these cracks, which when smaller cracks can become deeper cracks, can become smaller pits, larger pits, and eventually the bone under the cartilage can get exposed, disturbing the composition of your synovial fluid and causing a rise of inflammation. It is very commonly seen in young active population like runners, young athletes. Females are a little bit more prone. The whole reason is their body mass density is governed by hormones which are on a periodic cycle, versus a male body has got testosterone which is ideal and maintains a particular concentration throughout the life. So that's a little bit affection on the femoral side. Also, female's body is a little bit less muscular as compared to males, so the compensation offered by the muscle is less as compared to the male counterpart. Again, the signs can be, there will be pain behind your kneecap, you can hear some crackling sound. Many times you do flexion extension, there can be some kar wala sound in your joint. There can be pain when you are taking steps or walking on uneven surfaces. jumping activities or bending activities can be. You can have a lot of stiffness when you sit idle in a particular position. So there are some grades for how we identify, and based on the grades we understand. So grade 1 and some cases of grade 2 are good for regenerative medicine, but if you are in grade 3, grade 1, grade 2 are reversible stretches, you can actually heal your cartilage. But grade 3, grade 4 usually progresses, and then arthritis can ensue. So again, some X-ray and MRI images. I'm skipping it because you may not understand and appreciate the MRI findings. But eventually we do can, if there is a grade 3, grade 4 and there is a full thickness cartilage loss, focal thickness, we have now technology through arthroscopy measures, we can also create cartilage. We have now synthetic cartilage available. Sometimes we can harvest the original cartilage and regenerate it into a petri dish and then reattach again, so that the cartilage cover is complete, so that the joint does not progress to osteoarthritis. However, sometimes the injury is missed and this thing can progress to an osteoarthritis where the incidence is increasing in our country. More than 65 years of age, almost 80% of the population will be showing radiographic signs of osteoarthritis. So, osteoarthritis is the new common norm. जैसा हमने बाल सफेद होते हैं एक्सेप्ट कर लिया है, वैसा it is very common. If you go look into your family or friends or someone, at least one individual you will find who will complain of knee pain or back pain. Very, very common with the new lifestyle in which vitamin D levels are going low, vitamin B12 levels are going low. It is very great initiative what Sir is trying to promote, that he is trying to introduce that fitness thing into the general masses. But there are so many of us who, with the advancing age, exercise is a very remote thing which people indulge in. So what is the osteoarthritis typically? It is shown that it behaves like a tire. जैसे आपका टायर के रिजेस घस जाते हैं, your tire really पूरा उसके serrations में, something similar, the cartilage gets worn off and the bone starts getting exposed. On the left you see how a normal knee looks and right where a arthritic knee looks. So this synovial fluid which I was trying to talk to you, it acts as a lubricant and offers nourishment to your cartilage and the meniscus. As the first step, the synovial fluid tries to get dried up, and then your joint becomes stiffer, joint becomes hard in movement, you can hear this crepitus sound. With advancing things, with the degeneration, normal axis is such that the hip, knee and ankle should be in straight line. But as the joint, you can see some deformity. The joint space equal होना चाहिए था. With time, the joint space can decrease. The cartilage at stage 1 can show this kind of crackling, can become deeper cracks, and subchondral regions can get exposed. Some subchondral cysts, the infant synovial fluid which is supposed to be nourishing, can seep in and create this subchondral cyst. Eventually the joint arthritis becomes severely arthritic, and there is some extra bones which will alter your bony shape. The entire architecture may get deformed and you will see deformities outside. आपका जो फॉरवर्ड प्रोपोर्शन गेट का वो लोड शिफ्टिंग गेट हो रहा है. आपने देखा रहेगा नाना नानी पार्क में काफी बार लोग थोड़ा सा ऐसा डक की तरह बैडली गेट ले रहे हैं. That is because they are not able to move forward. They are trying to offload one side and load onto the other side. And this is how arthritis typically progress, and pain is the thing which is the silent killer. It takes away a lot of things. Because of this pain, psychologically it affects us. Family members are going out, I am not able to join because I am in pain. Sometimes your daily activities, your activities of daily living, जैसा मुझे मंदिर जाना है या मुझे market जाना है, I am not able to do that. There is fear of fall. There are so many things which can affect your patient. So arthritis can affect in all these joints mentioned here. Typically clinical signs are pain, stiffness, limited mobility, crepitus, alteration in joint shape, deformity, requirement of crutch support or a stick support, and typically the patient tries to curl up. जैसा सिनेमा हॉल में हम पैर उठा के बैठते हैं तो कैसे कभी in that position they find some relief, and in that way the muscle can undergo contractions and stiffness again. So the whole idea of treatment is to give a pain-free joint, to increase the range and improve the muscle strength. Again, the diagnosis modalities can be physical examination, X-ray, CT, MRI, and once we understand what stage you are in, we offer that kind of treatment. Basically, if a correct patient presents in an early stage, as I told you, stage 1, stage 2 can be completely reversed, even OA with regenerative medicine. And stage 3 can be delayed. You can delay the progression that it will never reach in stage 4 in your lifetime. But if you have reached stage 4, we don't have any other option but to offer you surgery. So this is a pyramidal graph where majority of the patient, if we control them in the early stage, simple things like education, exercise, weight control, pain relief by braces, walking aids, intraarticular injections like GFC, regenerative medicine, can stop you from getting those surgical treatments. So these are what are the modalities. Maybe Dr. Imraan will throw some light on that. Later, non-operative treatments. But in case, God forbid, if you really are in stage 4 and everything, really today's technical advancement research, we offer something called minimal invasive customized robotic joint replacements, which offer you a much more complete return to your original pre-arthritic self with the longevity of implants running almost to your lifespan and offering you a very quick rehabilitation program to an extent कि जो दिन surgery हो उसी दिन हम लोग within 2 hours we make the patient walk. I have my friend here whose mother-in-law has also been undergone bilateral knee replacement by me, and we have got a very fast quick result with complete mobility in the joints. So total knee replacement essentially means the arthritic part is replaced by metal back implants, which have to be customized as per the joint. Many a times, most of the surgeons are trained on 1 or 2 systems and they apply. सबको nano गाड़ी देखा ये हॉल में चले जाते हैं. There are some tall people who want a SUV, some short people who are comfortable with the Beetle, and then there are mid-range people who will use a sedan like Honda Civic. Similarly, the joint configuration also needs to be customized to that person. Minimal invasive allows us to get out without disturbing any muscular or any soft tissue injury, and that's the reason why our rehab program, which typically if you see your friends or colleagues who have undergone this thing, will have a 3 to 6 month recovery. We offer hardly 2 to 3 weeks of recovery. So within a month you are, in fact from before discharging from the hospital, you have been given permission for unlimited walking, staircase climbing and comfort chair sitting. So once you go home, even before stage 1 you are independent. You don't have to have anybody's support to offer any functionality help assistance. So intra-articular injections typically are graded into these 4 types. Steroids, which I am completely against. PRP was the norm before GFC and hyaluron came into place. So PRP, I explained you, they are platelet-rich plasma, which offers regenerative medicine to a very small extent. Hyaluron is basically the natural component or the protein of your synovial fluid. So it adds up to the quality of the synovial fluid, it adds up to the lubrication. Very early stage we can use it, but growth factor concentrate or regenerative medicine is the new thing which has potential to reverse your osteoarthritis. You have a chance to completely cure or reverse if we select you in a very early stage, stage 1, stage 2. Unfortunately, if you present to us at stage 3, stage 4, that is the time when at stage 3 we will try to delay your progression. At stage 4 it is more like a time-bound procedure till you are psychologically or financially getting ready for your joint replacement. So just now we have been using this from PRP, GFC, PRP. Let us understand what PRP is. So it is autologous conditioned plasma, which is platelet-rich plasma concentrated of platelets are derived from your blood and injected into your joint. GFC stands for growth factor concentrate. So we disintegrate your platelets and release the growth factors. Various growth factors are stored in your platelets, and the alpha granules of the platelet degranulate. So this is a brand name under which we are offering this treatment called Osinex. आप GFC बोलोगे शायद किसी को समझेगा नहीं, but Osin, you can Google it. It is, the literature is freely available on the net. What Osinex does, it comes in a kit form. The indications are variable from osteoarthritis to any periarticular injury, sprains in early form. We take your blood, we introduce into the test tube has got an inner lining which is coated with a cation, and this cation disintegrates the platelet. This is put into a centrifugal machine which causes centrifugation at 3,400 rotations per minute for 10-minute time span, which isolates the PRP into such kind of gel. The topmost layer is the GFC. The thixotrophic gel separates the cellular components from the growth factor concentrates, and we introduce them into the joint. Many times लोगों को लगता है कि ये हड्डी में जाने वाला है. नहीं, this is gone into the space which will act onto your cartilage. Let us skip the mechanism because much more scientific things. So PRP versus GFC, definitely GFC has got much more higher concentration of growth factors and the final outcome is much more better. We are trying to finish off the talk now with some examples of how it will help in periarticular soft tissue injuries like tennis elbow. I am going to shed some light on most common periarticular soft tissue injuries. टेनिस एल्बो बहुत कॉमन है, बहुत बाद में रियलाइज हुआ जब सचिन तेंदुलकर पहनने लगा वो बैंड, ये क्यों पहन रहा है, ये क्यों पहन रहा है, अच्छा टेनिस एल्बो इज अ थिंग, ओके आई एम आल्सो हैविंग दिस टेनिस एल्बो, especially when I am trying to squeeze the clothes or I am trying to knead the dough or I am trying to do some screwing movement, this thing pains on the outer aspect. So this is where the point is where the 7 muscles are originating from that particular lateral aspect of the bone which can have injury. PRP can be done in such kind of things if we, because there is no great surgical outcome for this, so it is always better to identify it earlier, offer some collagen extracts, offer some GFC therapy and get it sorted. So we identify the most tendermost point. There is a triangle where your nerve also passes and we carefully under clinical, if you have a good expert surgeon, you can get clinical guidance or sometimes you can be also done on sonography guidance. Plantar fasciitis is another nuisance I would say. बहुत बार आपको होता है कि मेरी एड़ी दुख रही है, स्पेशली जब ठंडी आ रही है, बारिश का सीजन आ रहा है, कभी कभी जो नॉन वेजिटेरियंस है, कभी मैं प्रॉन्स ज़्यादा खा लिया, मेरे को एड़ी में दर्द चालू हो गया है, अचार खा लिया, खट्टा दही खा लिया, एड़ी दुखने लगी, वेरी कॉमन, लेडीज बोले कि मेरा यहाँ एड़ी से हड्डी उग रहा है, whenever I want to wear heels, but now it is very troublesome because I am not able to use it. So plantar fascia is a fascia on the undersurface of your sole which connects the 3 points on which we stand, ball of great toe, ball of lesser toe and heel. These 3 points are connected and unfortunately you have an injury when it is circled at the heel, and the heel will, especially if you have a very high uric acid or you have inflammatory joint disorder or you are into a lifestyle format, especially runners or jumpers who land on their heel. So in that case scenario, there can be a tear at the insertion of the plantar fascia. Such kind of uric acid can deposit over there if the value is, so normal value is somewhere we should maintain it at 3.5, but if it is going below 4.55, it can deposit at that zone. If the value is going higher, then this uric acid has to be neutralized by the calcium released from the body and it causes calcium urate salts and that's what deposits at the end of the insertion. And आप अगर एक्सरे देखोगे कभी-कभी आपको दिखेगा कि हड्डी उग रहा है. So this is the source of pain at this place also. We can offer you a GFC therapy. Achilles tendon very commonly. जो चीज़ आपको वहाँ हो रहा है यहाँ पे भी हो रहा है. I will like to demonstrate one case. This is a surgical case. A patient of mine had this Achilles tendonitis which he ignored royally over longer time, and eventually the imprint, the जो आपकी Achilles tendon की पकड़ है आपके बोन पे धीरे-धीरे वो छूटती गई, and he had a rupture of his tendon Achilles. So if you see, I can put my thumb in that dip, and when I try to squeeze, there is no movement in the foot. So ideally, जब आपका calf muscle contract करेगा, आपको joint में movement होना चाहिए. But here we don't see any movement. This is a clinical marking. I'm sorry if the pictures are troubling you, but don't worry, they are all blood free and we do it very bloodless surgeries. So I'm trying to show you some pictures from the operation theatre. So faint-hearted, please be aware. So yeah, this is how we have diagnosed it. So when we open, this is how the tendon was completely ruptured. We could not help this patient in early stage because of the ignorance from that side that the tendon had to be ruptured. We had to take a good suture bite. We use these tapes called fiber tapes. They are very, very strong Dacron tapes which have a good hold onto your tendon. We reattach the tendon with suture anchors. So these are bioabsorbable anchors. They go into your bone and get dissolved. So you try to have a reattachment of your tendon or ligament onto your bone as if it was your natural attachment. But we would have had to wait, non-weight bearing वगैरह. So what we did, we used Osinex. We extracted the GFC. We injected into the ligament. Now it is so fast acting that it starts its work the moment it comes in contact with that tissue. As we did that, this is a post-operative video. If you see, If I squeeze the calf, you can see the movement in the foot. So that early is the recovery. If we can show this recovery within the surgical theatre, imagine the impact, the time which we could save for the patient's recovery post-operative. This patient would have had bedridden or non-bed bearing for at least 6 weeks, and he is completely mobile within 2 weeks. So we have saved 1 month of recovery pattern and given him back his life, and he can within 3 months he is again back to his normal walking, running, whatever. So this is the impact of getting a correct treatment done at a correct place with correct modalities. So rotator cuff, many patients, I hope nobody is here, but then you could always see there are people who say kanda upar nu utha hai, frozen shoulder, very common thing to talk amongst yourself. You go to Nana Nani Park, half the people are doing this movement. I'm really scared for them. This is a crazy movement sometimes people do, and a small tear can actually get into a complete tear, and then you have a surgery. So it is not कि ऐसा घुमाते जाओ. Then you will really, what rotator cuff is, basically shoulder is a ball and socket joint. The ball is very big and the socket is very shallow. This enables us to have a very wide range of movement, so that we are the only animals, one of the few animals on this planet who can cross our midline and do jobs on the other side. You see dogs, elephants, they can't cross the midline and do that. We can do that because of this virtue. But this makes our shoulder joint a very big joint. So to protect the ball within the socket, we have 4 muscles. Together they are called rotator cuff muscles because they are the stabilizers of your ball within the socket. Now along with stability, they also offer mobility. So these 4 muscles, one from above, one from front and 2 from behind, they are also initiators of movement. तो जो ऊपर से आ रहा है वो हाथ को ऊपर उठा रहा है, जो आगे से आ रहा है हाथ को अंदर घुमा रहा है, पीछे से आ रहा है हाथ को बाहर घुमा रहा है. But try to understand these rotator cuff are very weak muscles. They do not have strength. So they only वो दिशा अर्पण कर रहे हैं, डायरेक्शन दे रहे हैं. The strength is offered by this big muscle called deltoid, जहाँ पे आप इंजेक्शन दे रहे हो. तो शोल्डर 2 मसल के इसमें गवर्नेंस में काम करता है. एक छोटू मसल जो डायरेक्शन दे रहा है, मोटू मसल जो मूवमेंट दे रहा है, स्ट्रेंथ दे रहा है. बट ये छोटू मसल है जो इम्पिंच हो जाता है, इट गेट्स डीजनरेटेड because of your wear and tear, because of whatever activity. Diabetes and thyroid patients are more prone for this, depending upon the functional usage, overhead usage, जैसा teachers है, school teachers, badminton, tennis players, electricians or engineers who do heavy work, overhead abduction वाला work. Those patients are usually more prone for this. And when your body tries to heal by adhesions, जो fibrinotic bands बनते हैं, वो stiff हो जाते हैं, and then you call it frozen shoulder. But ये कभी-कभी program you have a tear. So given a point, if you can identify in an early stage, we can use TFC therapy here as well, in which we try to reorganize your collagens. These are just injections. These are not surgery. These are not cuts. There is nothing, but it does work wonderfully in early stages. We are also backed by literature. These are some literature papers in which we have done trials. It is not something which we are doing. We practice a lot of evidence-based medicine. So we have our own trials done, animal trials versus human trials, and we have given conclusions. So it is very much research-based, and the results have such that the conclusion points that it does work. So if you want to have any take-home message, GFC is a non-surgical modality. No platelet loss or high concentration of growth factors are introduced into the affected pathology. It is completely acellular, so there is no risk of any pain or post-injection inflammation. It has got excellent stability. The composition is always reproducible to same concentrate. It is a very safe option because your own blood is going into your own body. There is no cross reaction. There is no cross chemical reaction. There is no risk of contamination because it is blood is taken into the vial and the vial is centrifuged and immediately introduced. So there is no risk of contamination. It's a simple protocol and there is very less operator dependent variation. So even if this is done at a not so well trained setup, still the configuration is so simple that only the doctor should know where to give. उतना मालूम होना चाहिए, वो भी गड़बड़ करेगा तो फिर उधर ना. So yeah, I'm sorry for such a extensive talk. I tried to concise as much as possible, and I'm really thankful for such a sincere audience who listened to this patiently. And yeah, that was all about soft tissue injuries. suffered by athletes, suffered in our daily activities of living, degenerative versus sports oriented, and that was my take for you. Thank you, thank you.
Dr. Imraan Khan, would you like to add something? Then I will ask a few questions, and if that is not covered, then we will throw the floor open for questions.
Am I audible?
Yes,
Thank you. So, alright, so let's get into some interaction here. I want to know more about you all as well. We'll take question and answer as suggested. A bit about me, which I think you should know before I start talking. As I'm also an athlete, I do a lot of running. I have completed 35 marathons. Out of that, 12 were half marathons and 7 were full marathons. Thank you. I'm also a cyclist. I have done a lot of cycling so far. In fact, just today morning I did 25 kilometers of cycling before going to work. And tomorrow I intend to do 100 kilometers because I'm going for a cyclotron tomorrow. And also I'm a BRM racer. I have completed 3 BRM races. I've done 200 kilometers, 600 kilometers and 900 kilometers of continuous cycling. I'm also a triathlon athlete. I have done 2 triathlons. Both of them were relays. I haven't completed the complete Ironman yet. I intend to do it in the coming year, which is 2025 in the month of November. It's in Goa, 70.3. I completed 2 marathons where I did 21 kilometers of running plus 90 kilometers of cycling both together. Swimming is my weakest side. I'm working on it. So hopefully I'll be able to achieve that as well. Now, I'm also a researcher. I do a lot of researches. I've published 13 researches. Out of that, 7 were international papers. And out of them, 4 were in sports. So that is where I met Dr. Girish, and we do a lot of work together. And I am sure with his talk you must have understood he's full of knowledge. When we sit together and we discuss about each and every patient, there's a lot of knowledge and discussion going on. And that's how we can improve our patients. So we've been doing a lot of work in our hospital. Now, apart from that, let's come to your topic. That is, first of all, I would like to thank sir. I did a little bit of research before coming here, that's just to know more about him, and I got to know that he's doing a fantastic job. So, especially, sir, I would like to appreciate the part he's doing for post-CABG patients. He's motivating them to stay fit and to get them as much as possible. And that's an amazing thing. That's an amazing thing. We also do cardiac rehabilitation at our setup. So we understand a bit about that and how important it is to motivate at that age. So whoever here in this room is doing activities apart from your surgeries, your ailments, kudos to you all. So that's a good job you all are doing. Right? Now injuries. See, sports, when you challenge yourself to certain limit, definitely you're bound to get injuries. Okay. Most common injuries, even when you're walking or running, sir has beautifully he has touched few topics which is very common. I'd also like to add two areas. People get groin pain, people get knee pain, shin pain, ankle pain. These are basic common ones. Okay. Let's go a little bit detail into that. You need to understand difference between strain and sprain. Okay. If you understand strain is something which whenever there is an issue with the muscle or tendon. Muscles होते हैं, tendon होते हैं, वो bones को attach होते हैं. Simple. Sprain is something which you get a joint, soft tissue or capsule. ये सारी चीजों को जब होता है तब ligament, these are sprains. बहुत common नीचे से ऊपर आता है. बहुत common चीज है flat feet. You all aware flat feet बहुत लोग बोलते हैं, बहुत physios बोलते होंगे आपको. Flat feet ये ऐसा चीज है जो आपके muscular जैसे आपका growth हो रहा है उसकी वजह से भी हो सकता है या बचपन से भी हो सकता है. And many of the times हमारे जो नीचे के ligaments हैं वो उनमें laxity आ जाती है जिसकी वजह से flat feet होने के chances हो जाते हैं. If you have flat feet तो आप समझिए आप पूरी की पूरी body आपकी base के ऊपर चल रही है. Base ही गड़बड़ है ऊपर तो डामाडोल होना ही है. तो बहुत ज़्यादा बायोमैकेनिकल इश्यूज होते हैं जब अगर आप फ्लैट फीट रख के आप बहुत ज़्यादा वॉक कर रहे हैं, बहुत ज़्यादा रनिंग कर रहे हैं. तो सबसे पहले आपको वो चेक कराना है. एंड वो चेक कराने के बाद आपको एक एक्सपर्ट से मिलना है, उसका सोल्यूशन ढूंढना है कि क्या है. मेनी ऑफ द टाइम वी हैव सोल्यूशन, एक्सरसाइजेस and some splintings and some insoles, but sometimes we don't have because if there is a navicular drop हम ज़्यादा कुछ कर नहीं सकते उसके लिए. Then we have to look at surgical opinion also. Sometimes we have to just give you परमानेंट सोल्यूशन कि आपको इंसोल देके आपके पर्सनलाइज इंसोल बना के हम आपको भेज दें आपके शूज वगैरह में डाल के। ये हो गया इसकी बात। लोगों को फ्लैट फीट होता है तो आप लोगों को समझना चाहिए कि बहुत सारी चीज़ें आपके पूरे लिगामेंट्स इम्बैलेंस है, आपके मस्कुलर इम्बैलेंस है। लोगों को स्प्रेन बहुत होता है, एंकल स्प्रेन बहुत होता है। एंकल स्प्रेन को सीरियसली लेना है। एक बार स्प्रेन हुआ है तो आप छोड़ दोगे, देन अगेन होगा, फिर छोड़ दोगे, फिर अगेन होगा। दैट इज क्लियर इंडिकेशन दैट यू आर नॉट फोकसिंग ऑन इट। एंकल स्प्रेन पे आपको बहुत ज़्यादा फोकस करना है। यू कैन इंश्योर दैट यू आर मीटिंग द एक्सपर्ट एंड अंडरस्टैंडिंग एंकल स्प्रेन, क्या इशू है, कैसे इसको हैंडल करना है। अगेन इजी सोल्यूशन है इसके। कमिंग थोड़ा ऊपर, shin splint. Shin splint is a common thing. People who does distant walking or distant long distance running, you need to understand shin splint again is a common thing. ये आपके यहाँ पे आगे की तरफ में जो है पेन होता है, ये कंटिन्यूसली पेन होता है। इसको एक और डायग्नोसिस है जिसमें स्ट्रेस फ्रैक्चर भी बोला जाता है। कई बार बहुत लोग ज़्यादा भागते हैं तो स्ट्रेस फ्रैक्चर भी हो जाता है। तो डिफ्रेंशिएट करने के हमारे पास तरीके टेस्ट होते हैं, हाईली एविडेंस बेस्ड टेस्ट होते हैं जिसको हम पता करते हैं कि ये क्या है। Again, very simple solution for these things. Okay. Next thing, your knee. सर ने already cover किया है, jumpers knee, patellofemoral pain. ये बहुत common चीज़ है, runners knee भी इसे कहते हैं। वहीं अक्सर लोग होते हैं कि हम खड़े हो रहे हैं, चल रहे हैं, चलने के वक्त ज़्यादा दर्द देता है, सीढ़ी चढ़ने उतरने के वक्त पेन देता है। Otherwise it is fine. या थोड़ा सा ज़्यादा रन कर रहे हैं तो मिड रनिंग में इशू होता है, स्टार्टिंग में इतना इशू नहीं है। ये jumpers knee है। हमारा जो पटेल में सबसे पहली पिक्चर बताई थी नी की, तो बहुत सारे मसल लगे हुए थे। 3-4 मसल्स हैं जो आपके पटेला को भी अटैच होते हैं। तो वो मसल्स में कमजोरी होने की वजह से पटेला हमारा आगे पीछे ऊपर बराबर मूव नहीं होता है। दैट्स व्हाई यू गेट नी पेन। अनदर थिंग इज IT बैंड सिंड्रोम। लोगों को बहुत बार इस साइड पेन होता है या नी के लैटरल साइड में पेन होता है। तो कई बार आपका IT बैंड टाइट होता है, उसको स्ट्रेच करना बहुत जरूरी है। तो ये कुछ कॉमन इंजरीज है वो एक एथलीट्स में, स्पोर्ट्स पीपल में और पीपल हु आर रनिंग। In this room, I am assuming everyone to be someone who is doing some sort of activity. If not, it's high time कि आपको करना चाहिए. Clear message. I might be hitting some people very hard, but it's very important. No matter what age you are, I think that's the message what sir is giving. You too can run, because everybody should have that spirit to do something, right? We are being called India's diabetes capital. Are you aware of this? Yeah. So it's a big thing. We need to understand that physical activity बहुत ज़्यादा important है. There are guidelines to it. Various countries have given. We Indians also have recently developed guidelines which says 30 to 45 minutes of exercises, 5 days a week. It should come to 150 to 200 minutes of exercises per week. ये होना ही चाहिए. अलग-अलग टाइप की एक्सरसाइज कीजिए, हर एक जॉइंट्स को इंक्लूड कीजिए. Pain. Let's understand about pain. Pain is a perception. There is it's an alarming system of your body to tell you that something is going wrong. Whenever you get pain, take seriously. That's the message even sir wanted to give. And many people do these things, many people do a lot of exercise. We are happy about it that you all are doing it. But again, you need to understand if it's hurting, it is not right. Something is off. You need to differentiate between soreness and pain again. जो भी लोग यहाँ पे एक्टिविटी करते हैं, एक दिन एक्टिविटी कर ली, दूसरे दिन सोरनेस फील होता है, थोड़ा फील होता है कि हाँ थोड़ा सा अकड़ रहा है मसल, थोड़ा सा ये हो रहा है. There's a rule for it. सोरनेस रूल. अक्सर लोग एक मिस्टेक करते हैं, हम डॉक्टर्स बिरादरी वाले हम थोड़े से चिढ़ जाते हैं कि ये क्या पेशेंट करते हैं, तो वो डायग्नोसिस गूगल करके आता है, सर मुझे ये है मुझे ये है. तो हम ऐसे होते हैं कि ठीक है आपको है तो फिर आप इलाज कर लो. But I tell you, ये सच बात है. डॉक्टर गूगल. But I always encourage people कि आप गूगल कीजिए. We are blessed into this world जहाँ पर बहुत सारी चीजें हो रही है, बहुत सारी फैंटास्टिक चीजें आपके टिप पे ऊपर है, which is good. पर उसको यूज अच्छे से कीजिए, प्रिवेंशन पे यूज कीजिए. गूगल कीजिए इंजरी कैसे नहीं करना. जब मैं यूके में था, I tell you, I very much remember that patient of mine who just walked in. He was a 76-year-old patient in shorts. He just walked into my clinic and my entire team was like, क्या करना है, uncle is not saying, and he wanted to meet me and me only. So I was like, okay uncle, let's talk about it. What is it? So मैंने बोला, how can I help you? He's like, अब मैंने उनसे इंजरी क्या है, क्या तकलीफ है? कुछ इंजरी नहीं. मैंने कर क्या रहे हो यहाँ पे? आपने आधा घंटा वेट किया, मेरी टीम पूरी परेशान हो गई थी, बताइए मैं हेल्प कैसे करूँ? तो मुझे इंजरी है ही नहीं. मैं आपके पास ये बोलने आया हूँ कि मैं मैराथन तो भागूंगा, मुझे इंजरी से बचाओगे कैसे? That is the concept. You see that paradigm shift. That's the kind of mentality people have कि मैं तो भागूंगा, मुझे भागना है. मुझे आप बताओ कि मैं नेक्स्ट दिन आपके पास इंजरी लेके कैसे नहीं आऊँ, तो मुझे ट्रेन करो। दैट्स द मेंटालिटी वी नीड टू हैव दैट कॉन्सेप्ट कि पहले से प्रिवेंट करो, पहले से अंडरस्टैंड करो कि कैसे चीज़ों को करना है, पेन को कैसे समझना है। सोरनेस रूल को समझो, 5 रूल होते हैं, 5 ग्रेड्स होते हैं सोरनेस के। इसको गूगल करो कि क्या है ये सोरनेस रूल। ये गूगल करोगे कैसे हम इंजरीज को प्रिवेंट कर सकते हैं, क्या कॉमन इंजरीज है। ये करो, टू फास्ट इज ऑलवेज बैड। प्रोग्रेशन जो होता है, जैसे आज मैंने सोचा चलो आज मान लिया मेरी बात सुन के हो सकता है कल सुबह कोई महान इंसान सोचे कि चलो लेट्स डू सम एक्टिविटीज, आई विल बी वेरी हैप्पी। चलो आपने सोचा कल सुबह वॉकिंग करते हैं, डॉक्टर साहब ने कहा 30 मिनट चलना है। मेरा ये मतलब नहीं कि आप कल सुबह से 30 मिनट शुरू करें। अगर आपको वॉकिंग की आदत नहीं है तो ऑफकोर्स 30 मिनट भी आपके लिए ज्यादा होने वाला है। तो आप उतने लेवल तक शुरुआत करो जहां तक आपको दर्द ना हो, आप कंफर्टेबली कर सकते। वो आपका डे 1 का रूल। फिर आप वीक प्लान करोगे कि अब मैं हफ्ते में 3 दिन चलूंगा, बीच में ब्रेक दूंगा और मैं धीरे धीरे से उसको प्रोग्रेस करूंगा। अगर मैं फर्स्ट डे से 10 मिनट चल पाया था तो आज मैं 12 मिनट चलने की कोशिश करूंगा, 15 मिनट चलने की कोशिश करूंगा। तो ये से धीरे धीरे प्रोग्रेशन होना समझना बहुत जरूरी है। वॉकिंग में, रनिंग में, कोई भी एक्टिविटी में पैटर्न होना चाहिए। इसको वार्म अप, कूल डाउन बहुत बोला हमने, इतना बोला हम तो परेशान हो गए वार्म अप, कूल डाउन सुन। बट इसका बेसिक फंडा अगर आपने 30 मिनट वॉकिंग का सोच रखा है, स्टार्टिंग का 10 मिनट आप नॉर्मल पेस पे चलेंगे, जो पेस आप कंफर्टेबल हो, जैसे मार्केट में चलता है। बीच का 10 मिनट इज योर एक्टिव पार्ट, उसमें आपको थोड़ा सा तेज चलना है, पावर वॉकिंग करनी है, ब्रिस्क वॉकिंग करनी है। लास्ट का 10 मिनट अगेन हमें स्लो चलना है। ये पैटर्न बहुत जरूरी है ताकि आपके मसल पर ब्रेक लग सके। स्ट्रेचिंग बहुत इंपॉर्टेंट फैक्टर है। स्ट्रेचिंग मेरी खुद की एक रिसर्च पब्लिश है, 2017 का पेपर है, आप गूगल कर सकते हैं। नाउ दिस रिसर्च आई हैड डन इट ऑन स्प्रिंट रनर्स। कि भाई अक्सर लोग कहते हैं स्ट्रेचिंग करनी, क्या स्ट्रेचिंग करनी? क्योंकि जब मैं पढ़ रहा था तो मैंने पढ़ा बहुत डिफरेंट टाइप की स्ट्रेचिंग है। देयर इज स्टैटिक स्ट्रेचिंग, देयर इज डायनामिक स्ट्रेचिंग, देयर इज बलिस्टिक स्ट्रेचिंग। इतनी स्ट्रेचिंग है भाई, कहाँ से क्या करेगा इंसान? तो वी ट्राइड लुकिंग इनटू मोर एंड मोर, एंड उस रिसर्च में मुझे पता चला कि जो भी एक्टिविटी आपकी होती है, आप वॉकिंग करो, रनिंग करो, कुछ भी एक्टिविटी करो, उसके पहले डायनामिक स्ट्रेचिंग होनी चाहिए। आप क्रिकेट, आई एम श्योर एवरीबडी, मोस्ट ऑफ यू ऑल मस्ट बी क्रिकेट फैन हो, अगर आपने मैचेस देख रखे हैं तो आप देखते हो जब फील्ड में लोग उतरते हैं, हमारे क्रिकेटर्स दे डू दिस, बॉलर्स विल डू दिस, दे आर डूइंग स्ट्रेचिंग, दे आर नॉट जस्ट डूइंग ऐसे ही, वो स्ट्रेच कर रहे हैं अपने मसल्स को, डायनामिक स्ट्रेच। ये माना जाता है कि आपकी एक्टिविटी के पहले की जाए तो ये बहुत कारगर होती है, आपका परफॉर्मेंस बढ़ाती है। एक्टिविटी खत्म होने के बाद स्टैटिक टाइप की स्ट्रेचेज होनी चाहिए, जो आप देखते हैं अक्सर लोग करते हैं कि एक जगह पुल करके उसको होल्ड करते हैं थोड़ी देर के लिए, लेग को पुल करके मसल्स को स्ट्रेच करके होल्ड करते हैं थोड़ी देर के लिए। ये 15 से 30 सेकंड कारगर है। 15 सेकंड से नीचे अगर आपने स्ट्रेच किया है कोई फायदा नहीं, 30 सेकंड के ऊपर किया तो आप हल्का फुल्का डैमेज भी कर सकते हैं टिश्यू। तो ये स्टैटिक स्ट्रेचेज आपके एक्टिविटी के बाद होनी चाहिए। ये कुछ स्ट्रेचिंग के फंडे। मोटा we are just here to tell you that we see a lot of patients, we see a lot of clients. Even today we have very crazy schedule. Both I and Dr. Girish were struggling to manage time. We were like, let's do this because सुबह से लेके अभी तक मैं almost 18 से 20 पेशेंट्स देख के आया हूँ थेरेपी रिहैब, एंड हमारा मोटो टाइम निकाल के आपके लिए यही बोलना था that stay away from injuries, understand principle of progression, soreness समझिए, precautions लीजिए। पता एक एथलीट के लिए बहुत इंपॉर्टेंट है उसको ये समझना कि कब ब्रेक लेना है। सेम चीज एक इंडिविजुअल के लिए जब वो डेली चल रहा है उसको दर्द होगा तो उसे समझना है कि मेरे को अब ब्रेक लेना है। दर्द में भी चीजें मत कीजिए। एवरीडे वॉकिंग हमारी सबसे बेस्ट एक्सरसाइज होती है, बट अगेन वॉकिंग आप डेली अगर करोगे तो आपको चांसेस है नी पेन, एंकल पेन, हिप पेन होगा ही। आपने कई बार सुना होगा, आप अपने मित्र को पूछते होंगे कि भाई कैसा चल रहा है वॉकिंग, वो कहता होगा भाई चल रहा था, अब थोड़े दिन से दर्द दे रहा है तो बंद किया हो। ये है कि नहीं कॉमन? या मैंने बंद कर दिया क्योंकि दर्द दे रहा था इसीलिए। तो अगेन एक्टिविटी तो अपनी बेनिफिट के लिए होती है, हमने उससे दर्द बढ़ा के उसको बंद कर दिया, अच्छी चीज को बंद कर दिया। तो इसी के लिए अपने आप को काबिल बनाओ कि आप वो एक्टिविटी कर सकें। यू नीड टू अंडरस्टैंड कॉन्सेप्ट कि अगर आप वॉकिंग कर रहे हो रेगुलरली, जॉइंट में पेन होगा ही, कुछ टाइम अपर बॉडी की एक्टिविटी, हर रोज एक ही मूवमेंट नहीं करना। किसी दिन योगा करो, किसी दिन मेक श्योर दैट यू आर डूइंग स्विमिंग। Swimming is one of the best exercise. Make sure that you're going to gym या अगर आपकी सोसाइटी में जिम है, go there, do cycling, static cycling. If you ask me rank wise, डॉक्टर वाइज बताइए एक्सरसाइज क्या अच्छी होती है, तो रैंक 1 सबसे बेस्ट एक्सरसाइज इस पूरे प्लैनेट में यू आर ब्लेस्ड टू हैव इज पूल के अंदर एक्सरसाइज करना, स्विमिंग पूल के अंदर। आपको स्विमिंग नहीं भी आती है, इतने पानी के अंदर आगे चलिए, पीछे चलिए, साइड चलिए, ट्रस्ट मी दैट्स द ओनली एक्सरसाइज जो अपने जॉइंट पे कंप्रेसिव फोर्सेस डाले बगैर मसल्स की बहुत ही बढ़िया एक्टिविटी कर देती है, कार्डियोवास्कुलर भी अच्छा खासा पुश कर देती है। स्विमिंग रैंक 1 है, पूछेंगे रैंक 2 क्या है? रैंक 2 है साइकिलिंग। आप आउटडोर भी कर सकते हैं अगर आपकी जॉइंट्स वगैरह बराबर है, जो गुड इनफ। अदरवाइज आपको चाहिए तो स्टैटिक साइकिल, जैसे घर पे साइकिलिंग होती है वो। Amazon में बेसिक प्रोडक्ट्स भी मिलते हैं बेसिक साइकिलिंग के, यू जस्ट पुट अ पेडल एंड यू स्टार्ट डूइंग इट। देयर इज नो पॉइंट कि आप कहां से स्टार्ट कर सकते हैं, आप बहुत नीचे से भी स्टार्ट करके ऊपर पहुंच सकते हैं। सो दैट इज अनदर थिंग। थर्ड चीज, वॉकिंग। अवॉइड यूजिंग ट्रेडमिल एज मच एज पॉसिबल, स्पेशली पीपल आफ्टर एज 45-50। I personally don't recommend them treadmill because there are a lot of force का change which happens when you continuously walking on treadmill, which is not good for your knee. So definitely you should avoid. Strengthening पे focus कीजिए, हर रोज कार्डियो एक्टिविटी करते रहेंगे तो it will become an issue. बीच में strengthening exercise भी करिए। तो इससे बहुत सारी चीजें हैं आपको शेयर करने के लिए, हमारे पास टाइम की थोड़ी कमी है तो I won't take much time. But let's look at your question and answers. अगर कुछ भी doubts है, feel free to ask. Right? Thank you so much for having me.
First, a few questions from my side, through the floor. First is to Dr. Imraan Khan in terms of injury prevention. And injuries happen because of atrophy, not use, and because of overuse. Both can result. Now, fortunately, much of the population here is exercising regularly. So the concern is not atrophy, but the concern is overuse. And how do you, for example, you're doing so much of mileage, etc. Rajesh Gupta here has run about 500 kilometers in 1 month. High amount of use. How do you know that you are at the tipping point? And because there's always this play between training very hard and doing better and getting your PB and whatever you want to do. Then there's a push for that. At the same time, there's a tipping point beyond which you're going to get injured. I know it's part science, part art. But what is your take on that?
I love your last line, sir. It's part science and part art. It's exactly that. See, we need to understand there is no criteria to come up to a point जहाँ पे you will reach an injury point. There is no certain measurements or certain way to find out. Even if you have these smart watches and everything, you cannot find out exactly the point जहाँ पे आपको injury हो सकती है. So it is mostly मैं सारे एथलीट्स को बोलता हूँ that your training, your competition should be with yourself, should not be with anybody else. The moment you start competing with someone else, something else, that's the time you can go wrong. So you need to understand your own body. Your body is your own temple. You need to ensure that you are doing everything slowly. Now, जैसे मैंने कहा इंजरी प्रिवेंट करने के लिए सर का क्वेश्चन आंसर करने के लिए सी पेन फर्स्ट साइन है, हमें ये बताता है कि कुछ तो गड़बड़ चल रही है. देयर इज अ कॉन्सेप्ट बिटवीन ए पेन एंड दी पेन. ये कॉन्सेप्ट समझिए. ए पेन इज जस्ट अ पेन, राइट? Something which you have just got all of a sudden, and again the intensity is low. You don't worry about that. You can continue doing your activity. Your activity doesn't get hindered. Do not worry. Deep pain is something we need to be careful about. This deep pain is something which we have felt earlier as well. This deep pain is something जो हमें हमारी एक्टिविटी को स्लो कर रहा है. जैसे मैं पेस रखता हूँ तो मेरा पेस कम हो रहा है. This is something where I feel that I have to take break. This is something which doesn't give me confidence to go for my another race. अगर ऐसी चीज हो रही है, then this is the pain. That's exactly the point you're supposed to slow down and set back a bit. ये जो soreness rule मैं बता रहा हूँ, trust me, many athletes follow it, and the ones who follow it, they stay away from injuries in a very better way. So ये soreness rule क्या है, मैं थोड़ा सा आपको समझाता हूँ इस बारे में. ये 5 ग्रेड होते हैं. सबसे पहला ग्रेड है कि अगर आपकी सोरनेस एक्टिविटी के बाद या एक्टिविटी के वक्त हुई है, वार्म अप के वक्त आपको
सोरनेस फील हुई है और ये चली जाती है तुरंत, इफ दिस गोज अवे यू डोंट हैव टू वरी अबाउट। इफ यू फील कि आपको सोरनेस आई है एंड इट स्टेज लॉन्गर, दैट्स द टाइम यू आर सपोज्ड टू टेक ब्रेक ऑफ 2 days एंड व्हाटएवर प्रोग्रेशन आप जाने वाले थे आप एक स्टेप उसके नीचे आ जाओगे। सपोज मैंने लास्ट वीक 30 मिनट्स ऑफ साइकिलिंग में कर रहा था, इस वीक में मेरा 45 मिनट्स ऑफ साइकिलिंग था। तो मैं जैसे ही सेकंड वीक में आया, मेरे वार्म अप के वक्त मुझे सोरनेस फील होने लगी, कोई भी मसल में हो सकता है, कोई भी एरिया में हो सकता है। तो मैं 2 दिन का ब्रेक लूंगा और जब 2 दिन के बाद मैं चालू करूंगा तो मैं पिछले वीक जो 30 मिनट्स किया था वो करूंगा, नॉट विद 45 मिनट्स। This is the rule which you should follow. You should know when to restart, when to take a step back. Again, understand biology. You have to respect biology. क्योंकि ये प्रकृति विकृत है, ये हमारे कंट्रोल में नहीं होती। The way body heals, ये सब नेचुरल चीजें हैं। So जब भी कुछ इंजरी होती है या कुछ अगर पेन होता है, you need to respect biology. You can't force it too much. राइट बिकॉज जैसे सर ने बताया कि बहुत सारी चीजें सॉफ्ट टिश्यू में लोग ध्यान नहीं देते हैं। व्हेन इट बिकम्स बिग देन दैट्स व्हेन दे कम टू डॉक्टर्स के अरे ये प्रॉब्लम है, वो प्रॉब्लम है, ऐसा हुआ है, एंड तब तक गाड़ी बहुत आगे निकल चुकी होती है। तो यू नीड टू रिस्पेक्ट दैट आल्सो एंड टेक अ स्टेप बैक एंड नॉट टू पुश टू मच। प्रोग्रेशन स्लो रखिए, स्ट्रेचिंग्स पे ध्यान रखिए, वार्म अप अच्छा कीजिए। एक एज, अगेन मैं रॉन्ग मैसेज नहीं देना चाहता यहाँ पे, बट कई एथलीट्स मेरे पास अभी रिसेंटली एक एथलीट आए थे, शी वाज 54 year old and many podium she wins and she runs a lot of marathons. Even ये अभी recently वाला भी वो जाने वाली है। So I think Navy one is coming, right? Yeah. Coming week में। So that वैसे मेरा is getting clashed with that. So बहुत सारी चीजें इसमें हो रही है। तो she is running now, she's got a knee pain and उनको फिर भी भागना है, क्योंकि उनको ऐसा है कि मैंने एक रेस छोड़ दिया तो मैं तो भी पीछे हो जाऊँ। एंड जिन लोगों को मैंने सिखाया, ट्रेन किया, वो मुझसे ज्यादा जा रहे हैं, मैं नहीं कर पाऊँ, तो वो उनको बहुत खाया जा रहा था। तो she sat with me for half an hour and she barely mentioned about her knee pain, but all she was mentioning was this, though she was in lot of pain. हमने सिंपल चीज की, मैंने गिरीश सर की मदद ली, मैंने कहा सर ये समथिंग ऑफ है, मुझे समझ में नहीं आ रहा, प्लीज आप एक बार चेक कीजिए क्या इशू हो रहा है। माय बेट इज ऑन मेनिस्कस लिगामेंट, दोनों में से कुछ तो है, एसीएल और मेनिस्कस। वी टुक एमआरआई, वी फाउंड आउट दैट पेशेंट हैड मेनिस्कल इंजरी। So again we have to explain, तो उनको समझाना ये चीज बहुत डिफिकल्ट थी बिकॉज शी हैड बीन रनिंग थ्रू आउट हर लाइफ। तो उनको ऐसा है कि मैं एक्टिविटी के बगैर एक, और आप अगर सारे लोग एक्सरसाइजेस रेगुलरली करते हैं तो आप एक चीज से मेरी एग्री करेंगे, आप वो एक दिन कह दो एक्सरसाइज मत करो, रहा नहीं रहा। खुद से चूज कर लो, कोई कारणवश नहीं करना तो ठीक है, बट कोई और बोल दे कि नहीं आज नहीं करना, तो आपको और भी मन करता है करने का, कह रहे नहीं करना है, ऐसे कैसे नहीं करना। तो दैट बिकम्स वेरी डिफिकल्ट। तो हमको बहुत समझाना पड़ा कि देखिए आपकी एज देखिए, आपके एज हिसाब से कहीं ना कहीं तो आपको स्लो डाउन होना पड़ेगा। आप कंटिन्यू कीजिए, यू आर वेरी पैशनेट, बट अगेन आपको थोड़ा सा बायोलॉजी को रिस्पेक्ट करते हुए कम होना पड़ेगा। सो बायोलॉजी यू नीड टू रिस्पेक्ट, यू नीड टू मेक श्योर दैट यू आर डूइंग योर वार्म अप वेल, न्यूट्रिशन अच्छे से रख रहे हैं, वाटर इनटेक अच्छा रख रहे हैं। यू नीड टू अंडरस्टैंड कि आप किस टेम्परेचर पे आपकी एक्टिविटी करते हैं, वो भी बहुत इंपॉर्टेंट है। वेदर का बहुत बड़ा रोल है। You need to have a hat, cap or something that itself, you know, sometimes I had a trainer who used to tell me कि भाई कैप पहन के तुम भागा करो। मैं ऐसे सोचता था, मैं कहा सर क्या, सर के बात होने कम थे, तो मुझे ऐसा लगता था सर ऐसे ही बोल रहे हैं मुझे भी। But there's a rule because of moisture and everything, you need to ensure कि सनलाइट का भी बहुत बड़ा रोल होता है। तो ये बहुत ओवरऑल चीज़ों पे आपको ध्यान रखना है, तभी आप ध्यान रख सकते हो, आप इंजरी प्रिवेंट कर सकते हो। रॉकेट साइंस नहीं है, बहुत सिंपल है। But just be open to ideas, these kind of sessions, learning things, learn from each other, that will help you out.
Thank you. Dr. Bhalerao, we heard about GFC and how it can help in certain cases. In certain cases will be surgery candidates and certain cases may not be GFC candidates. So if there is a triaging, or if you know, can you explain how do you determine whether this is good for GFC or not good for GFC? Is there, I know it's very complicated, but are there certain steps that you follow to say yes, if you meet this criteria, GFC will help you. If you don't meet this criteria, GFC may not be the approach that you should take.
Yeah, identifying stage is very good. As I have been stressing more and more, कि a correct patient should come in that correct stage to receive this treatment. So there are three modalities in which we look into. Number one is clinical. Clinical means if your range is complete, or there is only terminal decrease in the range, or the stiffness component it is present only in the terminal ranges, and there is no crepitus, there is very minimal crepitus. देखो आप अगर किसी घर में भी किसी को हाथ रख रहे घुटने पे कुछ होता है जो थोड़ा सा माइल्डली से पेशेंट को समझ रहा है, आपको नहीं समझ रहा। दूसरा चीज है कभी कभी एंटायर रेंज में खड़खड़ 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 बज रहे कि बाहर तक भी आवाज आ रहा है। So there is much more variation. It takes clinical acumen to understand what stage you are. So that is clinical idea. वो जो हमको काफी बार ओपीडी में जब हम पेशेंट को देखते हैं उसकी जो बायोमेकेनिकल एक्सेस है, जैसे बनावट ऐसी है कि आपका जो हिप नी एंकल है, हिप नी एंकल शुड बी स्ट्रेट लाइन, ओनली देन कैन यू स्टैंड स्ट्रेट। जस्ट इमेजिन जिसके पैर सीधे भी है, अगर हम इसको टेढ़ा कर ले, यू हैव टू बेंड फ्रॉम योर बैक। सो विद दिस किसी आपने देखा रहेगा काफी पेशेंट्स के ऐसे रहते हैं, इसी पेशेंट के ऐसे भी होते हैं, कोई पेशेंट ऐसे भी होते हैं, विंडफील्ड डिफॉर्मिटी बोलते हैं। सो इफ द डिफॉर्मिटी हैज नॉट सेट इन, इफ द क्रेपिटस इज नॉट वेरी सीवियर, और if suppose the stiffness range is very limited, then you are somewhere in the early stage. Also age and your secondary history can also make a call कि आपको weight ज़्यादा नहीं है या फिर आपका immunity level कोई reason से compromise नहीं है। So definitely because GFC आना तो आप ही के blood से, अगर आपकी immunity ही compromised है, then also the GFC may not have that great potential. So sometimes you see people who on paper are 60 but do not look 60 at all. So then they're physiologically younger, their immunity in that way. So we have a lot of criteria to understand which patient to select GFC. X-ray wise जैसे मैंने बताया 4 stages होते हैं, तो हम लोग यूजुअली वो जो सिंगल जॉइंट वेट बेरिंग एक्सिस पे खड़ा करके जब हम उनकी गैप बैलेंस को इक्वेट करते हैं, तब हम उससे भी आपका ग्रेडिंग लगा के ग्रेड 1 ग्रेड, उसको कैल्विन लॉरेंस क्लासिफिकेशन स्केल बोलते हैं। एंड फाइनली MRI में कुछ चीज छूटता नहीं। If you are really that bothered, sometimes doctors are taking all the things, मैं बहुत religiously exercise कर रहा हूँ, फिजियोथेरेपी की एक्सरसाइज खत्म हो गई लेकिन मेरे को उतना सेटिस्फेक्शन नहीं मिला। Definitely MRI would add a lot of understanding कि what is the problem. Like he said meniscus, वो 54 year में सोचा ही नहीं कि meniscus होगा, because she has passed a certain age where we don't expect meniscus to be that big. But sometimes there is in that lady there was a meniscocapsular differentiation, जो meniscus capsule से अटैच है उधर, क्योंकि meniscus उतनी लॉक नहीं हो रही थी, it was in the anterior part which is usually missed, because when you are forwarding quadriceps से anterior stance लेते उसमें there was a snap and it was not been identified, क्योंकि clinically नहीं मिल रहा था, clinically में फुलाते slowly move करते तो वो snap नहीं आ रहा था, so only MRI could tell us. So we have to have these 3 modalities of understanding to determine what stage you fall. Sometimes people are younger and still can be in stage 3. Sometimes people are older and still have not. I've seen such pristine joints, people who are 80, 85 and zero arthritis. मैं कभी उनको पूछता हूँ क्या किया आप? So especially our country now, it is so much variability. There is so much variety. In Mumbai तो मतलब mix है. We all are Mumbai का, कोई किसी को आप इंटरव्यूज में जाओगे तो बोलेंगे मैं ये स्टेट का नाम लूँगा या डिस्ट्रिक्ट का नाम लूँगा। मुंबई वाला सिर्फ बोलते हैं मैं मुंबई का, कभी बोलता नहीं मैं ये हूँ, बिकॉज दैट्स द स्पिरिट ऑफ आवर सिटी एंड दैट्स हाउ वेरिएबिलिटी वी गेट दिस पेशेंट्स, लॉट ऑफ परमुटेशंस।
Thank you, doctor. You talked of artificial cartilage, something that is quite interesting, because you had also said that cartilage is a non-replenishable kind of thing. You just have a little bit of it and you kind of erode it over a period of time, and so therefore if you exercise and if you, there's only that much miles, and you give the analogy of the tire. And then you also talked about artificial cartilage. So obviously, one statement is kind of this. So how does artificial cartilage work, and when do you give it or prescribe it to someone?
Thank you. I because the topic is so wide, it is very difficult to explain in detail. But he has made a very specific scenarios कि cartilage मैंने ही बोला कि भाई इसका तो turnover potential नहीं है, फिर आप cartilage लगा भी रहे हो. So try to understand two varieties of patient. Let us consider a couple of first patient. First patient को acute injury हुआ है and his otherwise rest of the joint cartilage is great. But acute injury की वजह से he has got a very focal cartilage injury. जहाँ पे उसका cartilage कैसा होता है, cartilage के भी grades होते हैं. Again, everything has to be classified. If there is a just contusion, then definitely we try to treat with medicines and some injections or something. But suppose there is a full thickness loss and a very focal loss, 5 mm, 2 mm, 3 mm. Try to understand when the cartilage is lost, तो वो किसको वो कवच के प्रमाण ना आपके बोन को कवर किए हुए हैं, तो आपका सबकॉन्ड्रल बोन एक्सपोज हो रहा है. And now there is a small patch, very painful patch. That case scenario we can consider it with cartilage regrowth. So cartilage के वो सर्जिकली दो प्रकार है, एक को मोज़ैकप्लास्टी बोलते हैं और एक को कॉन्ट्राफिलर बोलते हैं. मोज़ैकप्लास्टी हम करते थे कि हमारे जॉइंट में कुछ नॉन वेट बेरिंग जोन्स है, वहाँ से cartilage cells scrape करते हैं. It's a two-stage procedure. We grow it outside the body in a petri dish. Along we can use GFC there also to enhance the cartilage cells to grow. Then we get a good plug, cartilage plug. उसको हम लोग हमारे पास एक्रिलिक जेल होता है, साइनोएक्रिलेट जेल, उससे बाइंड करते हैं and then we create a plug kind of thing and we plug it and we can even have micro sutures to stitch that cartilage back. But इसका एक ही चीज का कभी-कभी ना uptake, it's like transplant, kidney transplant, liver transplant जैसा. We take, we harvest, we regrow, we again repatch it. So sometimes the uptake is variable. Depend क्योंकि वो duration में कभी-कभी ना हमारे patient वापस आते नहीं हैं. हम उनको बोलते हैं you have to revisit us within 3 weeks or 1 month. Sometimes they don't come. And that petri dish में पड़ा हुआ उसका भी potential कम हो रहा है. So there are so many. But people who are focused do come. But the whole idea is कि sometimes the reuptake may not be that good. Second option contrafiller का ये single stage procedure जिसमें आपको ये सब चीज नहीं करना है. We now have got artificial cartilage which is in a liquid form. We dry up, we curate that damaged part, we expose the subcon. In fact हम और बढ़ाते हैं क्योंकि subchondral bone में totipotent stem cells है. तो इन stem cells को हम activate करके उसके ऊपर direct वो it's a pre-made synthetic syringe which has got chondrogen cells and the collagen material. उसको हम इंजेक्ट करके जैसा आप लीवर पे नहीं पैच पड़ा है तो आप प्लास्टर पुट्टी लगाओगे and then multiple coats देते पेंट का, first coat, second coat. So we keep on giving those coats to English. So this is called chondroplasty or mozaicplasty. मोज़ैक जब सेल्स हार्वेस्ट करते हैं, कॉन्ट्रोप्लास्टी जब सिंथेटिक यूज करते हैं. अभी जो दूसरा पार्ट है दैट इज डीजनरेट. When the overall thickness, suppose we are born with 5 mm of thickness of cartilage and over the age because of the usage degenerative, overall joint is showing depreciation of cartilage. Then your cartilage will crack up. जो मैंने आर्थराइटिस का स्टेजिंग में बताया, there are multiple cracks. Small cracks becoming deeper cracks exposing the subchondral bone, and then there are multiple small pits. Now these pits cannot be filled with mozaicplasty or chondroplasty. So when you are talking about acute injury versus chronic injury, and that's the chondromalacia जब होता है तो उसका प्रोग्रेशन दुनिया का कोई डॉक्टर एक्सपेक्ट नहीं कर सकते या प्रेडिक्ट नहीं कर सकते. Only at that stage when the patient is presenting. So it is a very eventful thing. आप कौन सी स्टेज में मेरे पास आए and then from that point forward I will do some prediction. आपका लाइफस्टाइल क्या है, आपका हाइट वेट क्या है, आपका इम्यूनिटी स्टेटस क्या है, आपका विटामिन डी B12 लेवल्स क्या है. So we get a profiling, it is called arthritis profile. So वो हम ब्लड टेस्ट में समझते हैं, कुछ इमेजिंग में समझते हैं and then collectively as per that particular patient we can devise a plan.
One quick question. Lot of aging population in the audience, and as we, strength training is important, but the muscles have sarcopenia, that is loss of muscle fiber, and often it involves extended DOMs because there's not enough recovery. So in this kind of a situation, what does an aging population do to maintain adequate muscular strength, and what should be the protocol? How should the protocol be changed for an aging population?
Very good question, sir. So, see, we always consider it to be a golden age, where things starts changing in other direction.
You start with a weak muscle, you work on it as you grow, and जैसे जैसे एज होती है तो हमारे muscles loss होना शुरू हो जाते हैं, which is again a very biological process. Three things in here. First thing is you need to ensure that all your minerals and vitamins are in place. So that's the first foremost thing, because these are certain things जो ये मालगाड़ी की तरह होता है, ये हमारे बॉडी में घूमते रहते हैं. जो इम्पोर्टेंट जो भी चीज़ें आप खा रहे हो उसमें से लेके जहाँ जहाँ देना चाहिए ये वहाँ देते हैं. So it's important to get your vitamins and minerals levels checked and work on that. Second thing, you need to understand that vitamin D is very important for your body. As you grow, you need higher dosage, higher amounts of vitamin D. So that by that there is a huge requirement of sunlight, because that's the highest and easiest source of getting vitamin D. Another thing is ensuring that you're giving your muscles adequate amount of food. क्या होता है with age ना, we are only looking at muscles now. We need to understand age में बहुत सारी other चीजें भी होती है. Sleep time कम होता है, तो rest time कम मिल रहा है muscles को. Then you need to understand appetite कम होता है. So अगर appetite कम हो रहा है तो आपके macro micro nutrients दोनों में फर्क पड़ना है. तो इसी के लिए nutrition पे बहुत ध्यान देना जरूरी होता है. You need to ensure everything. And last thing is doing a lot of activities. See, मैं बहुत ही देसी भाषा में समझाता हूँ, एक्चुअली ऐसा ट्रू है नहीं साइंटिफिकली, मैं देसी भाषा में समझाता हूँ कि जब हम ऊपर वाले ने हमारी बॉडी को ऐसे बनाया दैट इफ यू आर नॉट मूविंग योर मसल्स ना, तभी भी वहाँ पे उनकी खुराक थोड़ी जा रही है थ्रू ब्लड, थोड़ा बहुत तो जाएगा, बट जॉइंट्स के साथ ऐसा नहीं है. व्हेन यू डोंट मूव योर जॉइंट तो आपको वहाँ पे ज़्यादा मूवमेंट या ज़्यादा न्यूट्रिशन नहीं मिल रहा. तो ऊपर वाले ने इतने सारे जॉइंट्स दिए, वो चाहता तो ऊपर से लेके नीचे तक एक स्पाइन का टुकड़ा दे सकता था. इतने सारे टुकड़े दिए, इतने सारे जॉइंट्स दिए, सो दैट वी मूव. सो इट्स इंपॉर्टेंट टू मूव दोज जॉइंट्स. नाउ दैट बीइंग सेड, अंडरस्टैंड कॉन्सेप्ट कि अगर मैं जॉइंट को ज्यादा मूव नहीं कर रहा हूँ तो मेरे मसल्स बेशक नहीं मूव होने वाले. सो विद एज देयर इज फिजिकल इनएक्टिविटी व्हिच कम्स, क्योंकि क्वालिटी ऑफ लाइफ चेंजेस. इसीलिए हम ओल्डर एज में और भी ज्यादा प्रोत्साहित करते हैं दैट यू आर सपोज्ड टू मूव योर जॉइंट. यू आर सपोज्ड टू, इट्स इंपॉर्टेंट. मेनी पीपल कम टू अस एंड दे से कि अरे इतनी एज हो गई है, कहाँ एक्सरसाइज होगी. मैं उन्हें कहता हूँ क्यों नहीं होगी, आपको सिर्फ चूज करना है, राइट तरीके से करना है, बट व्हाई नॉट. इट्स वेरी इंपॉर्टेंट दैट यू मूव योर जॉइंट्स एट दैट एज. आप जॉइंट्स को मूव करने का फोकस रखेंगे तभी तो मसल मूव होगा, और मसल मूव होगा तभी तो उसकी डिमांड ज्यादा बढ़ेगी, और आप न्यूट्रिशन अगर अपना अच्छा रखेंगे तो वहां पे जाएगा. सो मसल्स आर गोइंग टू स्टे हेल्दी. सो इट्स अ विशियस साइकिल, एवरीथिंग इज कनेक्टेड. बेसिक फंडा यही है कि एज के साथ साथ भी आपको एक्टिव रहना है. ये कॉन्सेप्ट कि एज बढ़ रही है तो एक्टिविटी कम होगी, ये हटा के हमें फेंकना है बाहर, ऐसा बिल्कुल नहीं होता है. ऑफ कोर्स देयर आर सर्टेन एक्टिविटीज जो आप एक जॉइंट को बहुत ज्यादा चैलेंज नहीं कर सकते, बट अगेन विद इन लिमिट्स यू आर सपोज्ड टू मूव. अपनी जॉइंट को पूरी क्षमता के साथ अच्छे वे में मूव करना ही चाहिए. सो यू विल इंश्योर कि आपको फटीग जल्दी ना हो, आप सार्कोपीनिया को कंट्रोल में रख सकते हैं, आपके मसल लॉस बहुत ज़्यादा ना हो. एंड अगेन स्ट्रेचिंग एक्सरसाइज इन ओल्डर इंडिविजुअल इज वेरी इंपॉर्टेंट. स्ट्रेचिंग इन वेट बेरिंग बोथ. अगेन जॉइंट में अगर इश्यूज है तो वेट बेरिंग नहीं, तो गलत मैसेज लेके मत जाइएगा, बट स्ट्रेचिंग इज वेरी इंपॉर्टेंट. क्योंकि जब आप स्ट्रेच करते हैं ना, जैसे सर ने बताया था मसल और टेंडन का जंक्शन, टेंडन और बोन का जंक्शन, यहाँ पे खिंचाव फील होता है. जब खिंचाव फील होता है ना तो बहुत सारे न्यूट्रिएंट्स अंदर जाते हैं. सो योर बोन गेट्स स्ट्रॉन्गर. पीपल हु हैव ऑस्टियोपोरोसिस, पीपल हैव ऑस्टियोपीनिया, दे आर सपोज्ड टू, देयर आर लॉट ऑफ रिसर्च इज कमिंग इन नाउ व्हिच सेज कि वेट, पहले ऐसे कॉन्सेप्ट था कि अगर ऑस्टियोपोरोसिस है तो वेट बेरिंग जॉइंट ज्यादा एक्सरसाइज ज्यादा कीजिए, कैल्शियम कंजम्पशन ज्यादा होगा, बट कैल्शियम एब्जॉर्प्शन ज्यादा होगा. But now the research has been shifting towards stretching exercises, overall practice stretching, not one particular muscle. Overall stretching exercises कीजिए तो आपका और भी ज़्यादा बहुत stronger होगा. तो all these aspects you have to work together.
Thank you, Doctor. Last question before I throw it to the floor, and this is often a very popular question, and it is about nutrition. You know, what can you eat and what can you not eat, when it comes to good joint health and knee health. We know a lot of things. There are tablets. I'm taking a tablet called Tendocare for my ankle ligament, ankle tendinitis, etc. I don't know what good it is doing to me. So, given all this background, what is proven ergogenic aids that you can recommend that people should take for their, joint problems or, ligament problems or any general overall joint health? What can this? And specifically, there has been some good amount of talk about bone broth, being a very natural source of, collagens and all that. So your views on that, doctor?
So, though we are in India, we are blessed with sunlight. Believe me, when I was in Europe and UK and all, these people who धूप निकलते चुपड़े डालते थे, धूप लगे थे. We are blessed with sunlight and still majority, if you randomly pick up all this population and check your vitamin D3 level, including me, we will have low vitamin D. Such a sad state. The reason being, our lifestyle has changed in such a way, and frankly speaking, to cater to this huge population. ये क्वेश्चन हम इनको ओपीडी में हर तीसरा चौथा पेशेंट पूछते हैं, सर मैं क्या करूं विटामिन डी मेंटेन करने के लिए? A very sad answer. There are no food left. There is no food. If you Google it, you will not find any natural food resource जहाँ पे आपको विटामिन डी है. विटामिन डी currently is available only in fortified foods. Fortified foods जैसा Kellogg's, muesli या फिर कोई ऐसा जिसमें the vitamin D has been resourced and put into your diet. Natural food में ऐसा कोई food source बचा नहीं जिसमें विटामिन डी. विटामिन B12 का there is no vegetarian source. The only vegetarian source is milk and milk products, and today's milk quality is again questionable. Non-veg food में विटामिन B12 की मात्रा होती है. Unfortunately, जो तरीके से हम non-veg बना रहे हैं, it most of the time damages this. Plus, also to cater then again this huge population जिस तरीके का चिकन मिल रहा है, तो ब्रॉयलर चिकन है, अगेन less of thing. मटन है, रेड मीट अगेन increases uric acid, increases your oxidation potential, and there is a something called reperfusion injury in your cells. तो आप देखोगे ये बहुत पुराना कंसेप्ट है, जैसे सर बोल रहे कि बोन ब्रॉथ करो या फिर नॉन वेज खाओ तो आपको ये होएगा. But I'll tell you one concept. जो लोग ज़्यादा नॉन वेजिटेरियन है ना, जो लोग ज़्यादा नॉन वेज खाते हैं, their pH always remain acidic. अब देखो ज़्यादा आप ऐसे भी forget नॉन वेज, आप नॉर्मल वेजिटेरियन प्रोटीन भी ज़्यादा खाओ, जैसे सोयाबीन है या फिर पनीर है या फिर मूंग मटकी राजमा चावल जो भी है, you will feel lot of bloating and acidity. What happens to this acid? It has to be neutralized. How will your acidic pH get neutralized? By calcium reaction. Where will calcium come from? From bone. Eventually what is happening? Bone is going osteoporotic. So frankly speaking, anything has to be done in very much moderation. You cannot go crazy कि हाँ अभी मेरा फ्रैक्चर हो गया है, एयरलाइन फ्रैक्चर है, मैं पाया सूप रोज पाया ये पाया वो. Doesn't work. So yeah, bone broth, people have been recommending it, but try to understand bone broth will have marrow. That marrow is very high in cholesterol. आप देखो पाया करेंगे तो उधर एक तेल जैसा एक लेयर बन जाता है. Not very healthy option. Red meat, mutton, not very healthy option. Prawns, lobster, crabs, not very healthy option. Once upon a time for taste, okay, definitely मैं ये नहीं बोला बंद ही करो, खाओ, लेकिन moderation, because all these foods will increase your uric acid. Uric acid, lactic acid, these all things will eventually cause osteoporosis. आप देखो सिंधी सोसाइटी होती है, पंजाबी सोसाइटी, एविड नॉन-वेज ईटर्स, बट आप उनको 40-55 के बाद मिलो, very poor osteoporotic bones. Why? Because जिंदगी में है. But so everything has to be in moderation. Best quality is when you are crossing 40, 45. See to it that once in 2 years you check your B12, D3 levels. Keep it at pace. Keep them in check. You have to maintain your vitamin D3 above the level of 40, 45. At least 35. Lowest. क्योंकि लोग बोलते हैं सूर्य प्रकाश से विटामिन डी मिल रहा है. Absolutely wrong. सूर्य प्रकाश से कोई विटामिन डी नहीं मिल रहा है. सूर्य प्रकाश से विटामिन डी एक्टिवेट हो रहा है. विटामिन डी आपके पास होना चाहिए. Vitamin D, A, D, E, K are fat soluble vitamins. They will stay stored in your fat under your skin. When UVB rays touch your skin, which are present only in early morning sun, आप 10-12 बजे जाके धूप में खड़े हो, आपका स्किन का जलना है, उसको हार्म होना है, उसको कुछ UVC rays होते हैं which are harmful to your skin. So hence हमारे पूर्वज जो बोले सूर्य नमस्कार, उगते हुए सूरज के सामने सूर्य नमस्कार करो, वो इसी के लिए बोलते हैं. For UVB rays will activate your vitamin D and keep you. Even having this vitamin D like crazy every weekly popping pills 60,000 साल भर खाया फिर भी bone नहीं कम हुआ यार because it needs activation will happen through sunlight through exercise. B12 has got omega-3 fatty acids present in fish, has very good vitamin B12 level. If you are eating steamed fish, great. Fry करके खाएगा उधर भी डिस्टर्ब हो जाता है because B complex and C are water soluble. They will easily get damaged in fried food. So that अभी हम लोग कितने लोग steamed fish खा रहे हैं? Tasteless fish है, बिल्कुल बकवास, मजा नहीं आ रहा है. It is healthy. Healthy food is always tasteless. जो भी चीज खराब है ना, देखो पुराने टाइम ये भी बोलते थे कड़ी पत्ता खाओ या फिर नीम लीव्स खाओ सुबह उठ के. That makes your pH alkaline. Alkaline pH will add longevity to your life. आप में से अगर किसी को सही में जीना है ना, मुझे नहीं जीना, लेकिन मैं आपको बोल रहा हूँ किसी को बहुत जीना है ना, रोज सुबह 5 से 8 या 12, 10-12 नीम के कवले नीम के पत्ते खाएं. If you are practicing, it has been mentioned in Grantha Samhita, the Ayurvedic books which people follow. Even a snake bite won't affect you if you are eating it from so long. नीम के पत्ते very cheap, easily available. आपके पीछे के गार्डन में शायद नीम का झाड़ रहेगा, कोई पैसे भी नहीं देना. So keep your pH alkaline, and hence this Kangen water and the black water, Himalayan alkaline water concepts are coming. For the same concept, keep your pH alkaline. To keep your pH alkaline, you have to consume bitter food in moderation. That too, जैसे नीम के पत्ते हो गए, मेथी, शाकू, पालक, ये bitter gourds are very good. GOURD gourds, सारे तरीके के वो सारे मराठी में क्या क्या बोलते हैं, लौकी, so much things, but very irritating vegetables. Not everybody likes it. और लौकी का जो जूस पीने के कितने ज़्यादा बेनिफिट्स हैं आप गूगल करो, पेज खत्म नहीं होंगे. Yeah. So D3, B12 needs to be checked. Keep your uric acid in check. And what to eat. So how to you can prevent it. अगर sprouts खा रहे हो, मूंग, मटकी, दाल, राजमा, चावल, उसको sprout करो. Sprout will decrease uric acid, decrease the pH. Make the pH alkaline. And those जो गली आ रही है ना, they are rich in collagen. So what he is telling about tendon में collagen है. Collagen are integrated. जैसे आपके बाल केराटिन से बने, ये ligament, tendon, जो भी आपकी stretchable tissues है, ये सब में collagen है. There are 12 varieties of collagen. Collagen type 1 and 2 are present in your ligaments and your meniscus and your tendons. So and if you see some, you know Michael Phelps, किसको मालूम है? Fastest swimmer of the world. Yeah. So he has a body type which is called Brighton's criteria positive. उसके shoulder तक पीछे meet करते हैं. So if you see in your population, there will be people जिसका अंगूठा touch करता है, जिसका ये बहुत extend होता है. So these are very hyper mobile, hyper flexible joints. But it is good for activities like yoga, swimming. So you have to choose your activity also based on your body type. Not that these are sick people, but in them collagen type 1, type 2 is very less, and type 11, 12 is high. So their body becomes stretchy. These people are very good candidates to have ligamental injuries. They snap out, they break. आप देखोगे तो खड़ा है ना, घुटना सब पीछे की तरफ bend हो रहा है. Very weird to look at, but these are those people. But they are very good for this. So Usain Bolt, fastest runner. He has too much more collagen. He is very rigid body. Physically देखोगे same दिखेंगे. लोगों का sports बदल दोगे, they will terribly fail in their individual sport. So it is very important to know your body type also. What will suit you to have that particular type of diet. Diet पे बहुत भार है ना, सब प्रोटीन का के नाम पे मम्मी सोयाबीन खिलाई जा रही है, खत्म ही नहीं हो रहे घर के सोयाबीन. चावल में सोयाबीन, सब्जी में सोयाबीन. मेरी मम्मी तो रोटी में भी सोयाबीन डालती है. So we have to do everything in moderation. Quick formula, my mother's formula. So 6 kg she takes wheat, 2.5 kg she puts soybean, and 1.5 kg she puts ragi. Now for vegetarians, soybean is the richest source of protein to an extent. Soya chops have been aligned with chicken chops. So soybean is richest source of protein for vegetarians, and nachni or ragi is richest source of calcium for vegetarians. If you add that thing with vitamin C, you can allow easy integration into the body. So नींबू गुज्जू फूड में देखो हमेशा एक नींबू रहेगा बाजू में. महाराष्ट्र में गुज्जू थाली में रहता ही है बाजू में एक नींबू, या फिर ये तो दैट इज वेरी गुड सोर्स ऑफ एब्जॉर्प्शन. बट नींबू कल काटा, आज ब्राउन हो गया और आज निचोड़ा, वेरी बैड. तो जितना बेनिफिट है वो सब नेगेटिव होता है. इट हैज ऑक्सीडेटेड एंड इट विल कॉज इंक्रीज ऑक्सीडेशन एंड रेडॉक्स पोटेंशियल इन योर बॉडी. सो दही अच्छा फ्रेश है, बहुत बढ़िया, लेकिन दही खट्टा हो गया, मम्मी क्या कर रही है उसको कड़ी बना दिया, अरे इट इज नॉट इम्प्रूविंग. सो फ्रेश दही, कड़ी फ्रेश दही का भी बनता है, तो यूज कर. So yeah, these are some tricks and tips to follow.
Thank you very much. Anybody from the floor, anybody has any questions? We have some time for quick questions. We are, everything is not open.
Yes, also.
Doctor, regarding this cartilage, even though we don't have OA, how do we know that? Because runners are always worried after some time whether we will have the knee problem. What is the status of our cartilage right now? Whether it has deteriorated as compared to previous one? Is there any test of this?
So test तो MRI है. MRI is a very specific test. There is you can get direct answer to your question. There is no ifs and buts. ये होगा, वो होगा, जो है सामने सामने. That is a good test if you really want to understand the picture of your cartilage within your body. But question is, at this age, is what sport is good for you? So what Imraan said that brisk walking or power walking is great, cycling is great, but running may not be great. अब लोगों को ना बहुत confusion है ये brisk walking और running के बीच में. Any impactful activities is not great. Nobody can predict. मेरा आज cartilage अच्छा है, कल मैंने छोटा सा कुर्सी से जंप कर लिया, बट तब से मेरा पेन जाने लगा. You don't know because there can be this synovial fluid changes. Anyways, with age the synovial fluid composition changes. So they seep into your weak parts and form subchondral cysts. जब तक आपका लेयर बढ़िया तब तक चल रहा है ठीक, लेकिन कोई एक्सेस. So as your age increases, what you can do, you could go into more fluidic activities like cycling, swimming. वो आप जापानीज कल्चर में देखोगे they do air yoga. Yoga, air yoga. So these are power yogas are good for you. But any impactful, for that matter, climbing stairs is good for you. But getting down stairs is harmful. मैं तो पेशेंट को बोलता हूँ कि आप लिफ्ट से उतरो, सीढ़ियों से चढ़ो. पेशेंट बोलते सर मेरा घर तो चौथे माले पे, 3 माले पे, तीसरे माले से लिफ्ट ले लो या फिर ब्रेक ले लो. But climbing stairs is better than downstairs. Downstairs will cause impact. So choose your activity.
So you are suggesting regular MRI.
He said, how do I know?
Yeah, how do I know? Say grade 3, grade 4, that is when symptoms are there, people come to you. What about grade 1 and 2? Because there is nothing happening.
So nothing happens. See, the whole idea is if you have good complete range, the terminal range is not restricted. You don't find you are sitting idle. बैठ के उठने के बाद में, so I'll tell you what is synovial fluid. अपने केचप देखा है, केचप घर में सॉस है. वो केचप का बाटी रात भर रखो, सुबह उठोगे, try to tilt it, it is very thick. Now try to shake that bottle. It will become thin in consistency and it will easily flow out. Synovial fluid behave like this. So what happens when you are sitting idle, the synovial fluid becomes thicker in consistency and it offers cushioning effect so that this bone and this bone does not touch each other. But the sooner you start walking, the synovial fluid is supposed to translate itself into a very thin fluid which offers gliding movement. ये थिक टू थिन का जो ट्रांसलेशन है, ये अगर आपका स्लो हो रहा है, मतलब आपका साइनल, मतलब आप बैठ गए आइडियल पोजीशन में समझो 20 मिनट, यू गेटिंग अप, अरे आई एम टेकिंग टाइम टू गेट अप, दैट मींस द साइनल फ्लूइड कंपोजिशन इज चेंजिंग. दिस इज वन साइन. सेकंड साइन, विद दिस माय टर्मिनल एज, पहले मेरा पैर पूरा टच होता था, calf was touching my thigh, now it does not happen. Another sign, so stiffness, limitation of range of motion. Earlier when I was walking, I used to walk straight. Now my gait is little bit swaying. Again, a sign. Crepitus नहीं है डॉक्टर साहब, crepitus नहीं है. मेरा घुटना कोई आवाज नहीं कर रहा है, मैं सब कर सकता हूँ. चलने में तो तकलीफ नहीं है. बैठ के नीचे तो अगर मैं इंडियन टॉयलेट में बैठ जाऊँ या पूजा पाठ के लिए टोकरी मार के बैठ जाऊँ, उठने का टाइम दिक्कत आ रहा है. Stage 1. So these are how we clinically signs for you. He asked me very specifically क्या करूँ तो मुझे पता चलेगा. That's why I said MRI. That doesn't mean MRI is an expensive investigation.
And scary also, they throw out something else, you know. So.
Sir, actually I'm telling this. Many of my patients are मैं जब बोलता हूँ भैया आप ये करो, नहीं टेस्ट नहीं करना, लेकिन टेस्ट करेंगे तो कुछ निकल जाएगा निकल जाएगा, आप दवा चालू करोगे जो रुकेगी। अरे भैया लेकिन टेस्ट कर रहे हैं तो निकला तो अच्छा है ना, यू गॉट टू नो बिफोर इट कुड अफेक्ट यू। व्हाट्स द पॉइंट जब चीजें जुड़ गई है। So if a doctor is a practitioner, that we need to have a, see I tell you the difference between Western, they are not smarter than us. Western population doctor I have 6 years पढ़ा रहा हूँ मैं, वो अपने से जरा अपने डॉक्टर बहुत ज़्यादा स्मार्ट है। Unfortunately उनमें और अपने डिफरेंस क्या है? They have standardization of care. If you see a doctor in London, if you see a doctor at countryside, the standardization of care, the protocols that they apply are NHS government, which is common to the entire UK. That doesn't change. तो कोई डफर डॉक्टर भी मिल गया ना तो भी आपको ट्रीटमेंट वही स्टैंडर्ड की मिलेगी। लेकिन इंडिया में स्टैंडर्डाइजेशन नहीं है। इंडिया में आप यहाँ बैठे हो 4 गली बाद मिले तो देयर कैन बी चेंज, द डायग्नोसिस विल चेंज। सो दैट्स द होल आइडिया, हाउ कैन द डायग्नोसिस चेंज?
Now IMA they give protocols.
Sir, we are too big a country. Elections देख लो।
Can we have their cards?
Sure, that we can.
Dr. Imraan.
Yes, yes, sir.
Now you talked about biology.
Yes.
Biology, then you need to understand that.
Yes.
There is also psychology. Then biological factor and psychology. Most coaches, this is a very common line. They say that the limitation is in your mind. Ball is in your mind. Don't listen to your ball. Not our coach. Our coach. But most coaches say.
How many coaches have trained you?
So when do we decide whether the mind is right or the body is telling me now it's slow down. But there is something in the mind that maybe I'm taking it easy. I'm finding out excuses. Yesterday night late night हो गया, खाना ज़्यादा हो गया, झगड़ा हो गया, whatever. So when do we decide the mind is right or the body is right?
Simple things. A very good question. I think it's a very simple answer to this, that you listen to your body, even if you don't want to. Your body tells you with pain, with tiredness, with fatigue. But what about mind? You listen to your mind. So the simple answer is the way you listen to your body, because body is forcing you to listen. You need to start listening to your mind as well. And this is one in retrospection, or I would say reflection. I practice this method called reflection. There are 2 models. People who want to do a bit of learning, they can do this. There's something called as Cobb's model of reflection and Gibbs model of reflection. These are 2 different ways of देखने का तरीका कि क्या होगा. So after every single race of mine, sir, I'm not into too much time वगैरह, but I always intend to finish it. So I always, after my race, I sit and reflect. It's like, what went wrong? How was it? What do I have to do next to make sure that this doesn't happen next time? And this I inculcate in my practice as well. There were 7 appointments today which I had to see, but I could only see 5. 2 patients I couldn't give time. Now I feel bad about it, but then I just couldn't. So I sit back at home after doing a small meditation of 5 minutes, and I have a journal next to me. I just write down, because when you meditate, you're literally talking to your mind. Your mind is trying to tell you certain things. And the most thing which kept on coming bar, like I was trying to look at that white light or whatever people tell to focus on for meditation. But again, ये चीज़ मेरे को परेशान कर रही थी. I just open my eyes and I write it down. And that's when I get to know, okay, this is the root cause. So for an athlete, these days is very important. We go as a sports club. We have psychologists as well. They are a crucial part again, which was not there earlier. 20-30 साल पहले आप देखो, 50 साल पहले वो ये नहीं थे. अब ये जरूरी है, बिकॉज एक एथलीट को साइकोलॉजिकल फैक्टर भी समझना है. कोई भी इंजरी होती है, उसका एक बायो साइकोसोशल फैक्टर होता है. मैं आपको राज की बात बताता हूँ. हम कोई भी पेशेंट हमारे पास आता है, हमें पता होता है कि इसको इशू है नहीं है. टेस्ट में भी बहुत सारी चीजें नॉर्मल आ रही है, तो हमें पता चल जाता है कि सब कुछ बढ़िया है, बट यहाँ से कुछ तो गड़बड़ है. परसेप्शन, दैट्स व्हाई आई सेड पेन इज अ परसेप्शन. तो यहाँ से कुछ गड़बड़ है. इट्स सब्जेक्टिव.
मतलब मैं आपको चीटी काटा, 10 लोगों को काटा, 10 और 10 people will say we have सब लोग मार्क देंगे अलग अलग.
So ये सब्जेक्टिव पेन है, पेन इज अ परसेप्शन. सो उससे क्या होता है कि हम डॉक्टर्स ना, हम एक चीज देखते हैं, बायोसाइकोसोशल फैक्टर प्रेजेंट है या एब्सेंट है. सो इफ इट्स प्रेजेंट, दैट मींस दैट जो बायोलॉजिकल फैक्टर हो या ना हो, कम हो या ज्यादा हो, बट इट हैज मेड अ स्ट्रॉन्ग कनेक्शन विद सोशल फैक्टर एंड साइकोलॉजिकल फैक्टर. एग्जांपल, with this lady which I was talking about. Injury हो ना हो उनको पता भी नहीं था MRI के पहले, so इनको भेजा नहीं था उसके पहले तो उनको पता भी नहीं था. But she had a strong connection psychologically and now I can't do stuff. Now I'm gone. My career is gone. I am barbad. I can't do anything. I've lost my passion. Socially, I will tell you. Her friends were trying to call her कि मैम आप आ जाओ, आप भाग नहीं पाओगे तो चल लेना. She was not going. Socially also it was impacting. Her husband was trying to get her moved up. वो बोल रहा था function में चलते ही करते चलता है no, I can't go. I just want to sit at home and I don't want to. Do you see how it connects everything? So इसीलिए it's important. There is no way to find out sir. जैसे body आपको pain के बारे में बता रही है, you need to stop and listen to your mind as well. And it's very important to talk to yourself and understand what my body says. रात को अगर खाना ज़्यादा खाया है, सुबह आपको बॉडी बताएगी ब्लोटिंग के हिसाब से. तो वो आप चाहो नहीं चाहो बता रही है. But again, माइंड से आपको बात करने के लिए do I really want to go or should I call it off? Or should I reflect on it and see कि यार yesterday थोड़ा गड़बड़ हो गई थी. Next time I need to make sure that I finish my dinner at 8 and not a heavy one. So that's how you need to understand.
I will. Last question?
Yes.
Okay, last question.
Two of my personal discomfort which has happened. One was that plants facilities I'm getting the right
Right facility.
It's also ended up having a spur. So they normally say it doesn't have a cure. I mean, I have definitely experienced it didn't have a cure and it went on its own. Maybe it took a long time. It went to maybe 3, 4, 5, maybe 6 months. So, and still not say that I'm completely off it. But there's a niggling pain here. But 90 to 95% is on the scale of 10 pieces. That is number one. Number two, you also mentioned about climbing stairs, which is also, that is also giving me a little bit of worry because I had a problem climbing and also getting down. Knee pain coming in. Is that a first stage? Is that a second stage? I don't know. But if I take one step at a time, there is a pain. Not that it happens always, it keeps coming and going. But if I see a lady coming beside me, I take 3 steps.
Hey,
I don't get a pain. I don't get a pain. Maybe the lady thinks like that. So what I'm saying is, coming back to it, close part. If I take 2, 3 steps at a time, the pain doesn't happen. What is the cause for it? There is something which I should neglect, which I keep quiet about.
Sir, first thing I want to ask, I'm sorry sir. First thing I wanted to ask, आपने कोई expert को मिलके have you found out, tried finding out the knee issue? पर I'm sure आपको X-ray किया होगा, पता चला होगा.
Sir, expert in the sense, ortho, who gave me some exercises.
Right.
Which went on for some time, but again keeps coming in. You know, I have a fear that my legs may buckle if you really don't do it or if you don't take care of it. That worry is keeping on coming.
Yes.
So I stop. Then I stretch my legs, try to give a jerk to my leg, I mean the knee and all that, and then I do. Nothing happens. And it doesn't happen always. Is it something that I should attend to it or I should ignore or is it keep coming and going?
We will take this question separately. It was very personal one for you. It's not generic.
Before I leave, we make sure that we answer questions.
Yeah. So one-to-one you all can always talk. Sorry about this.
Not at all.
I want to, I stand up to say that. Be seated. Thank you very much. Everybody be seated, please. I want to thank, first of all, Wokar, Harpal Singh about who made this possible. And Harpal is a very good runner. And we met about 1 year back when he told me, when I asked him what do you do, and he told me that he actually heads this product. From about 1 year I've been wanting to conduct something like this. The idea again is that knowledge like this which is available with specialists should be made available to lay athletes, general athletes, and who knows who may benefit in what way, and you never know till this. So Hare ka time aata hai, and for this talk today was the time. So thank you very much Harpal for coming here. The second thank I want to do is to Bipla Foundation. when we worked with Vipla Foundation in terms of CSR, etc. And when I asked them that I need these premises, and BKC is a very center point today, and getting a place like this is also very unique. If you go and hire a commercial place, then obviously it's going to cost a bomb, and then everybody has to pay for it in one way or the other. So this has come to us free. So nobody from Vipla is here because Saturday they don't work. They also go to Vipla Foundation for making this possible. The next is to Dr. Girish Bhalerao, only in order of seniority. Nothing else. Okay. And I want Ram to come and give him a small bouquet of flowers as thanks to him. 1 minute. Photo. And I want Manohar to come and give a bouquet to Imraan. Dr. Imraan, sorry. Thank you. The snacks are outside. It came quite some time back, so it is getting cold, and some people are very particular about eating things hot. So, and we are all available. So you can collect cards, ask one-to-one questions. Even I did not ask my question about Achilles tendonitis. Many of you know that it's actually crippling, but I will do that separately. Thank you. Sorry.